Ia ono o le taimi whaatūlanga ina. Ia leala a tātou a mata ua tātonu nei le iwa. Ia ona e tele lava ni mta upu e fia whaasua atu i le mamalu o le au fia. Ia o le nei taimi e a ona tātou mua i le atua. Ia wai sau ma ono mea lea. O mea lea o te wala au atu ai le tina po le whaletua pensione malolo. ia sia lei pētaia, na te saunia se te salo tātou te amatai. Whaamoli.
I me atu ia o tō mea ni, a wai nei o ia, e whaavavau lava lo nā lofa, se i o tātou te talo. Lo mātou atua pa i ai, le atua alofa, le atua e anga le lei. O le atua o le na whaia le tangata, ia fōlinga i la wafio, i mea le lei uma o le neila lolangi. O mātou whaaftai le atua, ona o le nei maaftanga fia i le nei tae o fōu. Whaafetai le atua, i le nei pol kalama, ua mawhai ai o na mātou au wai, se i o mātou whaalongolongo, ma mātou wawa ai, po le ase au ngā. Mātou te tatalo le atu ai, ia e alofa i e ua whai maulu mtaitai. Ia fōa ia i la atou le tomai atoa, le poto ma le atama, o le iloa, o le whautauta, o le ami o tonu, a e sili le alofa. Se i whasoa mai o tangata, ina ia mātou iloa, mea le lei, a wale lumanai o le nei atunu. Mātou talo ina ia manuia nei whaatisinga, mai le amatanga e o le iunga. Ia manuia nei whai ngā mālo, ia iailo ia nganga o la wafio, e manuia ai o tangata wale lumanai. O la mātou te talo le ali e wha maangalo i mātou. Ia maangalo i mātou i le toto lo walopele o Yesu Keriso. Amene.
Whaftai lava tina mo le sausanga, ia lofa le atua fōa e le soifua maloloina ia te oe, whaftai. Whai mai o le tala o le fōwhanga i pe au langa waa ma pe au tangata. O manao ai tanga loa e fia malolo walilia i pe au o la loo. O la ngona nā i le taimi nei. Wata lilia o na ua tangata a toa le malu nei. Ai lepa ia i malae o totoa. Ina uanga le leile atua fōfoa o le lalolangi. O mawalunga ai le au ina le maasina i lo o soifua, ma si o mātou ola. O tātou fuati a whātasi ma o tātou so tuli le awa whātawhata. Ina ua i fo tama le fuata. O le ta ilia tula whana i o paia sausau ngata. I le papa le ngai e o aina, ma le wala le se e o tula. A e maia i langi tapua e o nofo i whalanga fua, ai se o tala ma le ama, o no le pāne i whausala. O upa ia whale atua, o sā ma whainga whale atunu, ai tai nane o upa ia whale malo. Nona ia le au tala ia o Samoa, la totali poi, ma pola pui ia upu. A fio maia, susu maia, tala maia au. Tātou sula le pule whaasoifua le atua, o tātou whisila whaiai le nei tae au. Mā lo le soifua ma le langi e mama, tālofa lava. Good morning, everyone. My name is Fai Ilangi po Wha Fai Ai, and I have had the privilege of serving as Deputy Medicaid Director for the past 4 years. Since joining Medicaid in 2012, I've been honored to contribute to the program's transformation over the 13 years. It is a great pleasure to stand before you today and extend a heartfelt welcome to the 2025 Medicaid Health Summit. This year's theme, o le ta'awenga tausoa whaatasi, ngā lulue whaatasi mo se Amerika Samoa maloloina, working together for a healthier American Samoa. It reflects our shared commitment to collaboration and progress in strengthening healthcare for our community. The primary objective of this year's summit is to highlight the importance of collaboration among Medicaid beneficiaries, government agencies, and healthcare providers. Through these discussions, we aim to develop strategies that will enhance healthcare services, reduce health disparities, and build a stronger, healthier future for the people of American Samoa. So at this time, I would like to introduce my co-host for the next 3 days. He currently serves as the head of Medicaid's Benefits and Eligibility Division. His expertise and deep understanding of Medicaid policies have played a crucial role in shaping the program into what it is today. It is my pleasure to present Leto Fa'atsualebao Fa'asavilinga Austin Asiata.
Tālawhalawa, everyone. Tālofa. Ia wa mai a saunoa whawhelo a iatu, ia le tamaitai sui whaatonu, ia whailangi, ia ai arepa ia man mamaru a sau nei. Ai ta tono nei tu la, ia le a whanga tonu loa le malama, ma viri tonu nei fia mai nei tusai ma le aunga le whaamu moe o nei aso. O le nei tu la, e ia te au le awa tele ma le whaaloalo, e tu ina atu ai le awa noa i le sui o le whainga malo Amerika Samoa. Tātou te leo whaatasi, malana fionga i le Lieutenant Kovana, le matua ia Pulu Mataala ai Junior, ia ono nisi fo ia tuatua noa tatau, mano. A le nei tae au wa su mai lona sui, ia le sunga ia Andrea Samoa, o ia o lo o whaima Executive Policy and Program Director ana fionga Lieutenant Kovana. Nā te whonga ina saunoanga whapitoa, e whai masui a le tātou whainga malo. Ladies and gentlemen, without further ado, Andrea Samoa for the special remarks on behalf of Honorable Lieutenant Governor Pulu Mataala ai Jr.
Whaftai lava mo le wanoa o te tula i atu mo le whaaloalo lava i le au fia i le nei aso matumo fie. Ai ona o tūlanga ua whaasanga i lava ma le tatou acting governor le nei tai au, tatou te tatalo ina ia manuia fo'i lana awatu i le whalemai, whaamalulu atu ai ona o tūlanga ia e le i tatou fuafuaina. Tatou te talo fo'i mo le taunu umai o tatou Kovana le awhionga ia Pulali o loo whai malanga mai fo'i o ia i le Aoteatea wa o nei mea o matangi ia e le taumate fo'i e whaatasi ai lo tatou wali. A le nei tai au, I want to stand in front of you. The acting governor prepared 4 pages of his remarks. And just imagine that our acting governor is right in front of you as I read his remarks to you. The remarks are as follows. Tahau Manuia, good morning. Thank you for this honor to offer my special remarks, as this is the first time that I get a chance to attend this Medicaid Health Summit of 2025. As you all know, your Lieutenant Governor Pulu speaks from the heart. And this very theme, working together for a healthier American Samoa, makes me wonder if you all mean what you say. We all know that statement, talk is cheap and walk the talk. Well, you all know I do not like talking. I love to walk, and some of you know ke I lava wo walk atu pulu I lo ofisa unannounced. I walk everywhere, mainly out in the field, and I know our elderly, those who are bedridden, village residents on dialysis, individuals with disabilities, and even our workforce are not receiving quality health care. I find out that grandparents are taking care of their grandchildren and the parents are at work. Most of these residents continue to show up at the LBJ and DOH health centers. I find out that drug users are scaring the elderly in their family and demand money to buy their ice. Ele o tali manao le tātou tautua I manao tātou tamāma tinama atutua. Tātou whānau o loo iai a whianga tū mau. This month, special education's theme is about Together We Can. And now Medicaid's summit theme is Working Together. I get tired of hearing these words, working together, when I know the Medicaid can do so much better in providing services that can be included in the state Medicaid plan so our people can benefit from. Medicaid must cover more services to our people. I know we are not working together when every day I get complaints of the waiting hours of our people in the LBJ emergency room. As you all know, one of Pula and Pulu's platform is to deliver quality health care. Pula and I want to empower our people to live a lifestyle as our ancestors did. They were active in walking, working the land, growing vegetables, singing, dancing, cleaning with each other. Look at me. I am healthier than most of you attending this summit. You all should know by now the concept of One Health. Everything is connected. The water, the land, the plants, the animals, the people, the streams from the mountain to the ocean, and even our spiritual well-being. I believe you all should do the following. American Samoa needs to invest in caregivers, nurse assistants, and midwives to lessen the burden on our nurses and doctors in the hospital and in the healthcare centers. Find ways to pay the caregivers in homes, pay for hospital beds to be placed at home for our elderly can be cared for on the bed but not on the floor. As our grandparents and parents are getting older and forgetting things, we need to create a friendly dementia support system. LBJ and DOH needs to start sharing data. And most of all, Medicaid should work with all the various health agencies and nonprofit to revise the state Medicaid plan to serve the need of the community and allow for various services. Hopefully, this will make this summit and its theme walk the talk and deliver quality health care. Whawhitai, and God bless all of you.
E pia toi mai se patipatitene mo le saunoanga mātou ngā fie. Ale ona fionga le liutena kovana, ia e ona fonga ina le sui mamalu, ia Andrew Samoa. E rei titi lava le nganga whaafitai, ale tamaitai whaatonu, le sui whaatonu, ia e mai se nei ofisa Medicaid. Ia ona sapsapaya fo ia whainga malo, e le ngata i o tātou taitai, na na fionga kovana, ma le liutena. Ia le vaai atu fo i lo tātou whaatasi, ma tamao le atunu. A o tau a fionga I sentoa, ia mai se foi a fionga I whaipule, o taitai o matanga ruenga taitasi, whaarurunga o ofisa, kampanim, pisinisi tu maoti, se ua mamalu mamaupu e pue le nei aso, ono o lo o tau a fifio mai, whawhitai tene lava. Ale nei tu la, e ia te ao le ava, ma le whaaloalo tu ina tuai le ava noa, I ne tamaitai whaatonu, ia Luisa Kwaia, ia mona na saunoanga amata, e talo alo ia e tātou whaamoe moe. We are pleased to welcome Luisa Sue Kwaia, affectionately known as Luisa, as the new Medicaid Director for the American Samoa Medicaid State Agency. Luisa brings over 30 years of dedicated service in both the public and private sectors, with a deep passion for improving the well-being of underserved communities. A proud BYU alum with an executive MBA and extensive leadership experience, Luisa has led initiatives that have positively impacted underserved communities, not only in California, Utah, but as well as American Samoa. From founding the largest literacy program in the territory to championing healthcare partnerships that improve outcomes for patients with rheumatic heart disease, her commitment to service has been unwavering. Please join us in welcoming our new Medicaid Director as she leads us forward with a vision of compassion, accountability, and innovation. Luisa Kwaia.
Thank you, Asi. O te tula I maleava e te tauai, aua ua pa ia ma mawalunga le ne whaatasinga tūlau. Tūlau I le mamalu I le malo. O lo tātou whaatasi ma le sui o le awhionga le Lutena Kowana. Le matua I a kuru ai Junior. Whaapea sui o le whono, le tātou whale mai. Ai mai se sui mai e kalesia e fia. Whaapea le mamalu o le tātou, au fia whelanu I le nei tūla o le aso. O te whailoa atu fo I le fia, o lo ui ai fo I sui o le kolisi I susunga o taitai, whaiaonga, ai mai se whanau o le kolisi, whaapitai tele I le awai mai. O le tātou manulauti, mo le nei tolu aso e whaapea, Ia tātou malulu e whaatasi mo le soifua maloloina o I Amerika Samoa, working together for a healthier American Samoa. Talofa, everyone, and welcome to our annual Medicaid Health Summit. It is an honor and privilege to welcome each of you here today. Thank you for joining us. I am humbled by the appointment of Governor Pula and Lieutenant Governor Pulu to serve in this new capacity. Our Medicaid team is deeply committed to serving the people of American Samoa and fulfilling our mission to provide access to quality health care for our people. At present, Medicaid unfortunately does not cover everyone nor everything. This has been a persistent challenge for American Samoa. However, I believe that challenges are opportunities in disguise, opportunities to be innovative, to create new partnerships, and expand services so that no one in our community is left without care. That is our vision, and it is our goal to ensure that everyone in American Samoa has quality or access to quality health care. As many of you know, Medicaid plays an essential role in American Samoa. Unlike traditional Medicaid programs in the United States, our program operates under a 1902J waiver, which gives flexibility to design healthcare solutions that meet our island-specific needs. This flexibility has enabled Medicaid to support the LBJ Hospital and the Department of Health's community health centers, to fund off-island medical referrals, and to provide critical services such as vision care, dialysis, medical equipment, and medevac support. Notwithstanding these services, there are yet many gaps in our healthcare system. There are families who do not qualify for Medicaid and who struggle to afford care. There are elders in our community who need long-term services that Medicaid does not fully support at this time. There are individuals whose conditions require specialized care that isn't available on island. These gaps in our system demand greater attention and our collective efforts. For perspective, Medicaid was established in 1965 as a federal and state partnership to provide healthcare coverage for low-income individuals and families. Unlike Medicare, which is managed fully by the federal government, Medicaid is managed jointly between the federal government and the states. For U.S. territories like American Samoa, however, Medicaid operates under a unique set of challenges. While states receive open-ended federal funding, territories must operate within fixed federal allocations and formulas, requiring us to be strategic to maximize the funding we can draw down. Despite our funding limitations, our mission remains the same: to provide access to essential health services and improve health outcomes for our people. My vision for Medicaid in American Samoa is to ensure that no one is left behind. While Medicaid can't cover everything right now, we can do more. We can do more to collaborate with healthcare providers, our federal partners, and you, our community leaders and beneficiaries, to fill the gaps in our healthcare system. Our focus must be on 3 key areas. Number 1, expanding local healthcare services. Number 2, building stronger partnerships. And number 3, empowering our community. Number 1, we must strengthen our local healthcare infrastructure here in American Samoa. This means improving the services available at LBJ Hospital and DOH's community health centers, investing in preventive care, and supporting more healthcare providers in our community who can deliver essential care. Number 2, building stronger partnerships. We must restore and expand our relationships with trusted medical centers in Hawaii and other referral locations. We've already taken important steps with partners like Straub Medical Center to ensure our patients receive timely and effective care when they must leave the island. And we are working on partnerships with Queens Medical Center and others to expand health services and reduce costs. Empowering our community. We must do more to inform our people about their healthcare options. And that's why you're here today, here at the summit. Too often, families don't know what resources are available to them or how to navigate the system. By improving outreach and public awareness, we can help families make informed decisions and connect them with the care they need. This is the reason for this health summit. We know that change takes time, and we are moving forward with purpose. Together with my incredible Medicaid team, our healthcare partners, and the unwavering support of Governor Pula and Lieutenant Governor Pulu, we will continue to work to expand access and improve services to our people. The road ahead will be difficult, given the $880 billion in potential cuts to Medicaid, recently approved by the House of Representatives and Congress, and now under review by the Senate, which could severely impact healthcare access for millions, especially our people. But I believe in the strength of our community and leaders when we come together, and I am inspired by the dedication of our healthcare providers and the faith of our people. I invite each of you to share your insights over the course of this Medicaid Health Summit, and to become more engaged in our mission of providing quality health care for all of our people. Healthcare should not be a privilege that only the rich and powerful enjoy. Healthcare is a basic human right that everyone in American Samoa deserves. Working together, we can build a healthier American Samoa. O le tā venga tausua whaatasi. Whawhitai tele lava, ma ia manuia le tātou whaamoemoe.
Tailava Director, for your remarks at this time. So before we move on and introduce our first presenters for today, we would like to introduce the team behind it all. And this is the Medicaid, American Samoa Medicaid State Agency staff.
First up, we have Philip Yosefo, and Philip Yosefo, known to many as Free, is the Administrative Division Head. Please stand to be recognized. Our Senior Administrative Assistant, we have Beverly Liu Tufuli at the table. Our Administrative Assistants, we have Gideon Mapusanga Jr., Wesley Hesse, also another administrative assistant.
And this administrative division ensures smooth day-to-day operations of the Medicaid program and services, human resources and workforce management. And Medicaid will not be able to function without the support of our admin team.
Moving along to our finance division, and this division is one of the most important divisions in the office of the Medicaid program. They are the ones who handle all our bills, make sure our bills are paid on time, so everyone can still go and get that health care that they need off island, or even get the services that they deserve here on island. And our finance division head, who is unable to be with us here today, is Mrs. Epifania Yosefo Solofa. Our staff accountant and our acting division head for the finance division is Wilhelmina Sadua Tonafao. She's not here today, but she will be joining us in the next 2 days. And lastly, our accounting technician is Nimo Mangil Salavea. And this is the Benefits and Eligibility Division. So this is the division that handles anything referrals related. Whether you want a wheelchair, you want to go to New Zealand, you want to go to Hawaii if you're eligible, if you want your eyeglasses from Dr. Lalawasi, Petaya Stephanie, this is the division that you go to. And this division, they serve at least 20 patients and walk-ins on a day-to-day basis. So we have our Benefits Eligibility Coordinator, Diane Savusa Leomiti, who is also unable to be with us today for family matters.
We have Mr. Letu Alesulu dealing with our DME and another benefits coordinator.
And we have Ms. Cora Talawenga. She is also our Benefits and Eligibility Coordinator. And then if you are approved and you're eligible for the program, our off-island Medicaid referral program to Hawaii, this is the person who will pick you up from the airport, take you to your hotel, take you to your appointments. If you need to go to Walmart, this is the person. Ms. Jennifer Ngatayala Sua, who is our Hawaii patient navigator. Yeah, that was how we stand. Wow, are your patients in Hawaii?
The Program Integrity Division is a federally mandated division within Medicaid programs, established to ensure the proper use of Medicaid funds by preventing, detecting, and investigating fraud, waste, and abuse. We have here Ms. Matilda Cruz, and she is the Program Integrity Division head. And with her depth policy background, Matilda has moved the PI division to where it is today, and we are looking at expanding this division in the near future.
In other words, Matilda is the Medicaid police. She'll say no to everything. Moving along to our Policy and Planning Division, our Informatics Policy Analyst and Acting IT Division Head, is Mr. Jeremiah Fale. So everything IT, down to these, professional presentations, that's our go-to.
Mr. Jeremiah Fale has been an invaluable asset to the American Samoa Medicaid State Agency since he joined us in 2023. He has been doing IT policy developing, providing technical support at the same time, and all other IT-related matters. We are looking at expanding this division as well in the near future.
So if you have any IT background, we will be taking resumes at the door at the end of the day. Another new, but also a very important addition to the Medicaid team is Ms. Manino Oilang Seula Reed, and she comes to us as our public relations officer. So everything down to the QR codes, organizing this event, and possibly in the near future doing our communications outreach into the public. Miss Manino Reed, this is in the future. Miss Manino Reed is the one who is handling everything for our communications and our public relations for the Medicaid office.
Last but not least, we have Dr. Annie. Dr. Annie Fuavai is our clinical medical director. She comes to us after serving our primary healthcare provider, LBJ, for more than 30 years. Her extensive clinical background has helped the Medicaid office review off-island referrals and put in place policies and procedures in assisting with OMR program. Thank you.
And now I know there's been a long presentation from the beginning, but before we move on to our actual benefits and eligibility presentation, our director would like to do a mental break with you all before we move on. Thank you.
Thank you, Asi and Langi. Let's give our hosts a big hand, please. It's the beginning of a great 3 days with you, and it's important for us to get a little mental break too before we start. I adopted this from the Mental Health Summit given by Ba'ato Fayono and his team. But we're going to take a moment to reset. Okay, everyone? I want you to empty your hands. This is a simple breathing exercise called box breathing. Could I have the background music down, please? This technique is used by athletes, first responders, and even the military to stay calm under pressure. And it works wonders for anyone needing to refocus. So sit comfortably with both feet flat on the floor, so you can make space for yourselves, and your hands resting on your lap. Close your eyes or soften your gaze. Breathe in slowly through your nose for a count of 4. 1, 2, 3, 4. Hold your breath for a count of 4. 1, 2, 3, 4. Now exhale slowly through your mouth for a count of 4. 1, 2, 3, 4. Hold for a count of 4. 1, 2, 3, 4. Slowly exhale through your mouth. 1, 2, 3, 4. And hold that empty breath for a count of 4. 1, 2, 3, 4. One last time. Inhale. 1, 2, 3, 4. Hold. 1, 2, 3, 4. Exhale slowly. 1, 2, 3, 4. And hold that empty breath. 1, 2, 3, 4. Now gently return to your natural breath. When you're ready, open your eyes and notice how you feel. A little more grounded, a little more present, and now you're ready for my team. Thank you.
Thank you. Thank you, Madam Director, for that lovely mental break. I think we all needed that. We're diving right into our benefits and eligibility presentation this morning. If you can see, direct your attention to the screen. There's a QR code. Again, we're trying to limit the use of paper, but if you do not have a cell phone and you are unable to get the QR code to submit any questions that you might have throughout this presentation, don't worry, we will give you a chance to voice your questions at the end of the presentation. So I'll give you 2 seconds to scan that QR code before we move on. Hey, Benefits and Eligibility Division. Again, my name is Austin Asiata, and I currently head this division. Po le vaenga o benefiti, o tautua ma'auaunanga al Office on Medicaid, ia and eligibility o aia ngava'a, if you are eligible for this service. O le mea moa lawe tauna malamala mai, first and foremost, Medicaid is a medical insurance plan that is federally funded. And I know if we understand that, then I know we'll understand why these benefits are available and who and why these people, certain group of population, are eligible for these services. Now, what that means is, o le Medicaid, o se insiua, o lo whaatupe mai e ma lo whaafetirani. And like any federal funding, any federal grants, there are rules and regulations and federal laws that stipulate the usage of such grants. Our Medicaid federal grant, it comes to us and then it says, this is how you're supposed to use this funding. How can you draw, this is how you're supposed to draw down this federal funding. And this federal funding can only be used for a certain whoever, and you'll find out in later this presentation who are eligible for these services. Now, I understand that the finance team, everything is, I won't take away that their roles are important in this office. I also won't take away the crucial role that our administration admins work on a day-to-day basis. But I have a feeling you're here today because you want to learn and have some knowledge of what the benefits are. O nasa o mea maua mai o Office on Medicaid, o ani tautua po ni au nanga that are available at the Medicaid office. Am I right? And then you also want to learn, am I eligible? This is the most asked question at the Medicaid office. Okay, how can I get a wheelchair? Am I qualified to get a wheelchair? How can I get a bed? Am I qualified? How can I go on the off-island Medicaid referral to New Zealand? Am I qualified for that program? Now today, it is my hope that when you leave here today, you'll understand the benefits and services offered at the Medicaid office, which is specifically the Benefits and Eligibility Division's roles and responsibilities, and you'll take with you home today. The roles and responsibilities of the Medicaid Benefits and Eligibility Division. Number one, we review referrals. When we say referrals, this is any service outside of LBJ. Any service that cannot be done at the local hospital in Whanga'alu, those are called referral services. When you need a wheelchair, you are being referred to get this service with the DME. Or durable medical equipment, prosthetics, orthotics, supplies, that is a referral service. When you need to get your eyes checked or get optometry services outside of LBJ with Dr. Laloasi Petaya Stephanie at the My Vision and Optics, that is a referral service. And then when you also need to go off-island for medically necessary health assistance, unavailable in the territory, that is also a referral service. So when we receive your referral from your doctor, it comes to the benefits and eligibility division. Now what we do is we thoroughly screen. What are you screening for? We are screening for eligibility. O le mea tā ua lava, e te tau o na ilo ina nei referral uma, e vava ai po o anga vaa le mai, anga vaa le tangata le whaanga senga sea. Now, thoroughly screening involves asking for your passport, asking for your local IDs. Your passport, and we get a lot of complaints, getting an ID, especially like tangata matua, our elderly. They're like, I don't have an ID, I only have my Tawa ID, my SNAP ID, and we will accept those more for our elderly folks. But the reason why we ask you for your birth certificate or your passport is to verify your legal name. That's the only way we can verify o lo wingoa sa'o lavalia, mo whāteita inga o au, o lo wingoa sa'o o whaasaviringa asiata, e re o Austin. Yeah. And then we ask you for your 2 local IDs. And I'm pretty sure we share the same maisi fo imatanga winga in trying to prove your American Samoa residency. If we cannot, if you and I, you know, what we've learned over the years is that a lot of us here only have 1 ID, and that's probably just a driver's license, only because you need it when you're driving. But I can say off of the top of my head that maybe just 30% come to our office with at least 2 local IDs. Now, the IDs that we do look for are IDs that we can verify, ones with expiration dates, like the American Samoa Voters ID, we accept that. Your driver's license. There's an American Samoa Vitals ID, we also accept those. Now, if you give us your military ID, and now I know, and it's nothing against the veterans. I am a proud product of a veteran myself, but we have to prove your American Samoa residency. And so we have expanded, knowing that it's lava IDs. So we have expanded our proof of residency to include maybe a utility bill under your name, an ASPA bill, your Astica phone bill, your Blue Sky phone bill, even your bank statement, and any other form of proof that you can provide to us. I think one Whaife'au even provided a letter from his church. Now, those are some of the proof that we need, because what happens if we cannot prove your residency? You are ineligible for said service. So it's documents, required documents, especially when it comes to referral services. 2, we coordinate logistics. What I mean by logistics is, for any service provided at the Medicaid office, a process. For example, if you are needing a medical bed from our local provider, which is MedQuest, can I have a show of hands, please? MedQuest, I see you here. This is our only durable medical equipment supplier here on island, and they are located at the Panga Plaza, and they provide all sorts of durable medical equipments. Now, I don't know if you've seen in the back there between the coffee station and the food setup, there are medical beds, there's a medical bed, there's a display of all sorts of medical equipments that are available at MedQuest. Now, if you are in need of any equipment, you will have to be prescribed or get a prescription from your doctor, both either from LBJ or DOH, and then it'll come to our office. What we do, and I'm just trying to get to coordinating the logistics, we have to set up coordination. It's sauna mato vala'awi o have a noa se medical bed. Is there a wheelchair, and what size of the wheelchair? So everything, we have to handle all of those to make sure everything is compliant. Now, if you're going on a medical referral, if you are traveling to New Zealand, say you are eligible for a service off island that cannot be done here on island, The Medicaid Benefits and Eligibility Division handles everything, all the way up until you depart the territory and go to New Zealand or Hawaii. We coordinate, even when you arrive, somebody picks you up, takes you to the hotel, takes you to your appointments, takes you to the hotel, takes you to grocery shopping once a week. And then we handle all of that, all the way up until you return safely home. The reason why we coordinate all of this is to make sure now, I'm not saying anything, but there have been patients in the past, we make sure you have your visa. We make sure you have your transit permit to enter a PIA and transit to New Zealand, all the way up until, your arrival and your departure. It is very important to the office that once we commit to a patient that is eligible, we have to see it through. Otherwise, lastly, the other crucial role is to make sure that everything is in compliance. Now, what I mean by that is to protect our office from, as Director mentioned, fraud, waste, and abuse. Fraud, waste, and abuse, make sure it's a five-level officer Medicaid. And that is why it's so hard. When we call and we notify you, I am so sorry, you are ineligible for said service. It's not merely because I just do it for, because I want to. It's because there are certain guidelines that guide the usage of these funds. Okay, it's important to know the referral services that are available on island as well as off island. For the longest time, LBJ has been our only provider here in American Samoa. And that's why when you do pay a visit to LBJ, Medicaid covers your ER visits. The clinical visits at Department of Health, those are also covered. And then we have durable medical equipment. As I mentioned earlier, we have any medical supplies that you might need. If it's available and it's covered by Medicaid, you are eligible for it. Prosthetics mo to low level. O me fa wenga ya de faonga pe a to low level pe a faina lo a mo wa tipi lo a to low. Ya le la va to ya ta so vai fa pipi ina ya po le ala va me mana o mia tam fa fa fitawi lava ina ia to fa fo isia ma do si ina ia to fo inava ile daily routine ma sanya the savannah. Optometry services, this was created back in 2022 when we expanded optometry services ifafoa to Male LBJ, Male Department of Health. When there was a provider, we amended the state plan to include optometry services, and you will find out later how many American Samoa residents that have been helped with this program. Now, what this program does at Dr. Laloasi Betaya Stephanie's office and clinic, it's a sumai lava. You will have to come into our office, register, and then the said documents that I shared with you, we would ask for your birth certificate or passport, and then we would also need proof of residency. That's all. Once you're approved, and then you will be able to access eye examinations, have your glasses checked, prescribed to you, and you're even eligible for contact lenses. Now for our off-island services. For the off-island Medicaid referral program, we have Medicis New Zealand, and they are located in Hawke's Bay, New Zealand. In Hawaii, our two providers that we currently have, and we have an agreement with, are Adventist Health Castle and Eyesight Hawaii. Now, as Director mentioned, we are looking to expand this provider network in Honolulu in the near future to include, and we're praying for Straub as well as Queens Hospital, but at the moment, we have Adventist Health Castle that are taking most of our cardio patients. They're taking our urology patients as well. And Eyesight Hawaii is a very good ophthalmology place in Honolulu, and some of our patients have been returned home successfully treated by Eyesight Hawaii. We do have air ambulance services available with New Zealand Air Ambulance. Air Ambulance, it's a medevac. Mo ila tau wa mana o mio na whaana nati atu I atu no e mamao ono se accident ono wande e mawhai lava ona tongwhitia I nei mana o mia vave lava fisoswani. E au ngā the service still air ambulance or a medevac. To New Zealand, we have New Zealand Air Ambulance Service, and for Hawaii, we utilize Optimum Air. For air transportation between American Samoa and Samoa, we contract with Samoa Airways, and this helps us with our transit to New Zealand. Our ground transportation, Medisys New Zealand, also provides transportation. As I mentioned, when you arrive in New Zealand, there will be someone there to pick you up, and that's Medisys New Zealand. When you arrive in Hawaii, and Medicaid covers that, and I introduced you Jennifer Sua. That's what she does in Hawaii. Amongst many things, she will be driving you around for your appointments and between the airport and hotel. Accommodations. In Honolulu, we have 2 providers for accommodations, and that is Pagoda Hotel and Ewa Waikiki Hotel. Pagoda Hotel is located in Ala Moana area, and it's really close. It's a good location because it's surrounded by Walmart, Ross, and all the good things. It really makes you feel at home where you can just walk to the eateries, and the clinics are also nearby. Ewa Waikiki Hotel is located at the end of the Waikiki Strip, and it is also a good place for us to stay. Now, we are looking to expand our accommodations, because I know yet to tere tātou fia nofoi Ala Moana, maisi hotel taungata, yes, to umai lava noa se mātou woe whawhina wai, ma whai negotiation, ia pe mata tala mai Ala Moana, ia Male Hilton. And our last service available is a Medicaid co-insurance program, and this is a program available for all our Medicare patients. O le Medicare is different from Medicaid. Medicare, you pay into it, you know, when you're working, it's governed by the Social Security, so you pay into it. Now, when you retire, you get your Medicare card, and you use that for your medical bills in Honolulu or anywhere in the States. Medicaid does not operate like that. Now, this program is available for our Medicare patients who travel to Hawaii under the referral program from LBJ to Medicaid. Awatulai Hawaii, it pick up in Medicare 80%. If you are Part A and Part B, and I know our Medicare patients will, they have a knowledge of the Part A and B, it's inpatient and outpatient services, you will be covered, Medicare will cover 80% of your medical bills. Now, that's when Medicaid comes in. Being the payer of last resort, Medicaid will pick up your 20%. Yeah, for you see 20% to ngana sfurta sitana, yeah, ne amai lava officer reimburse that. But el nga mo pidi tetele, duafe, anga imailalo, yeah, and the Fautuanga Motato Mamanu, Afape Ono Talala co-payment, or the lowest foot percent, yeah, it's on to the Siaki de Prince, Ide Ono Talala Pili. Moving along, eligibility. Who are eligible for the services provided at the Medicaid office? Number 1, U.S. nationals. Tangata nuu na whananawi Amerika Samoa. 2, U.S. citizens. Tangata nuu na whananawi Amerika. 3, lawfully residing non-U.S. nationals, children under the age of 21. Following the acts of No Child Left Behind, now, and it don't matter your nationality, your citizenship. If you are under 21 and you are residing lawfully in American Samoa, you have an immigration ID and you're living here, then you are covered by the Medicaid office. Now for local services, we also cover lawfully residing non-U.S. nationals and non-U.S. citizen pregnant women. The coverage, but only for local services. What does that mean? They are covered for durable medical equipment with Pango Plaza and MedQuest. They are covered for optometry services with Dr. Lalawasi. They are covered at LBJ. They are covered at Department of Health. But when it comes to off-island referral for our non-U.S. nationals and citizens, foreign pregnant women, they are not covered. So now services lava for alotoi fali. Now, there's an important note. All must be bona fide residents of American Samoa. Now, this is another question that we get a lot. Well, I was born in American Samoa. I am a bona fide resident. Just because you were born in American Samoa does not necessarily mean you are a bona fide resident. Now, what a bona fide resident means with the Medicaid office, you have to at least have lived here for a year. Lona winga, a solo referral nei, naso nei, aso luas furfao mati. A o oefata e move mai tutuila, ile masino watsea. You are not a bona fide resident of American Samoa. Lona winga, it's our interface. So we work closely, and how do we determine that? We do work closely with the Department of Legal Affairs. And I don't know, when you travel through immigration, they always scan your passports. And that's called a movement profile. And that's how we detect when you arrive and when you depart the territory. So we always have to work closely. Again, it's all part of being in compliance with our Medicaid federal regulations. So again, U.S. nationals, U.S. citizens, lawfully residing non-U.S. national citizens under 21, pregnant women for local services only, and everyone has to be a resident of American Samoa, a bona fide and true resident of American Samoa. Now, in the last year, December of 2024, we have expanded our coverage to include American Samoa permanent residents and American Samoa one-parent residents. Those who have immigration IDs of CA being permanent residents and AA being one parent. Now, what does American Samoa permanent resident mean? An American Samoa permanent resident is a foreign passport holder who has been living in American Samoa for at least 20 years, have served, paid taxes, worked in the government or in the businesses, in the private sector, and they have acquired this immigration status of American Samoa permanent residents. Ia o tangata nuu wa lewa na malanga mai wa luas furu tau sanga o tau tuainan malo matongi ala tau la fonga. Tangata ia o loo iai lalo le American Samoa permanent residents. O tangata ta uo tangata no fo mau I America Samoa. An American Samoa one parent is one of the parents was born in American Samoa. Most Fatsaita, for example, if I was a Samoan citizen and one of my parents was born in American Samoa, you qualify to be an American Samoa one parent citizen or resident, and that is an AA status. Now, what is covered, and that's the program, the extension of this coverage, we have called it the Ainga Care Initiative. And the Ainga Care Initiative offers services and coverage for all local services. So se service lava po se tautua se au nanga In Tutuila Mamanua, available, anga va'ai ya tātou CA, ya mā tātou AAs. Now, what are these services? As I mentioned before, we have the vision benefits, optometry services with Dr. Nalawasi. We have the durable medical equipment and supplies with MedQuest, LBJ, Department of Health. Everyone with CA and AA status are covered under the Ainga Care Initiative for local services only. Ia o le teimi nei, ere o kawaina tātou, ere iaisa extension o le Ainga Care to include off-island medical referral at this time. But when we get to off-island, there is a portion of the Ainga Care that can also benefit our American Samoa permanent residents as well as our one-parent residents. And that is the Medicaid benefits presentation. Now, we want to go deeper into the different services that are available. Now, as I mentioned, we want to get into the vision benefits. We want to talk about the DME program, or the durable medical equipment, prosthetics, orthotics, and supplies program. And lastly, I'll come back to explain the off-island medical referral. But right now, I would like to hand it over to one of my staff benefits coordinator, Ms. Cora Talawenga. She will be talking about the vision care benefits. Thank you.
All right, thank you. Okay, Tayo Manuia, so if we're allowed Leila Malo Laufia. Good morning. Eyeglasses and more for eligible beneficiaries. Since 2022, since its inception in 2022, up to March of this year, this month, our vision program has covered over 1,980 eligible beneficiaries and counting. Okay, vision care program eligibility. Okay. Children under 21, they receive full coverage once a year. So you are eligible to get vision care services once a year for children under 21. Eligible adults, they are partially covered up to 450, and this is for every 2 years. So there is an exception to this. If your prescription changes, then there is exception and you may be qualified to get your eyeglasses before the 2 years or before the 1 year for children under 21. Okay, vision care program enrollment process. Step 1, you register at our office. I will get to the eligibility documents needed. We will review, on step 2, we'll review and screen the documents for eligibility and approval. Step 3, then we notify you of your approval or denial, and then we'll also notify our vision provider. The last step, the provider will schedule your appointment, and then they will bill us, Medicaid. Okay, vision care program required documents. It may seem, I know it may seem like we are repeating ourselves, in which we are, and it's very intentional, because we do hope that by the end of today and these next 3 days, everyone will have a better understanding of our services and policies. Okay, for children under 21, we will need a parent or legal guardian ID to register at our office. We ask for a birth certificate or passport, updated immunization records. For birth certificate, passport, o le aso whanau po le tusi folau, ia o pepa tui tamaititi, ia male ID o le legal guardian or parent. Okay. For non-U.S. national citizens, children under 21, we need the immigration ID, birth certificate, immunization record, and parents or legal guardians local ID and legal documentation. Okay, for adults, U.S. nationals and U.S. citizens, we ask for a passport or birth certificate, and then 2 valid American Samoa identification. For the 2 valid American Samoa IDs, this could be a voter ID, the ASG ID that's issued by the Vitals office, or a driver license. Okay, and then lastly, our Vision Care program required documents for the Ainga Care initiative. American Samoa permanent residents and for American Samoa one-parent residents. We would ask for a birth certificate or passport, 2 valid American Samoa identification, and then the immigration ID and immigration petition o le inga fono mai le ofisa o le immigration. Okay, so this concludes my presentation on our Vision program. I will now invite Mr. Tu'u Alailisulu for his presentation on DME, durable medical equipment. Tai.
And good morning, everyone. My name is Letu Alesulu, and I will be presenting the DME, or Durable Medical Equipment Benefits Program. By the end of this presentation, you will also have a clear understanding of who is eligible, what are the required documents for the program, and also how to ensure a smooth application process to avoid delays. Ole nau ta inga ole itu lau tato famoe moe nei asu. Ina ia tato malama o ai anga waa. O a foi ia pepa wha mau e mana o mia mo le plokalam. Ia le ngata I lea o le whangai o ina, ia o me se foi le whanga solonga. Wa lava le tali atu ne ofisa I lau whatau sanga. The Durable Medical Equipment Program o le nei a plokalame sa whawaina I le tausanga I lua afes fun malvanu. LFI, prosthetics, orthotics, medical supplies. Sa whawaina ne plokalama e ova male 5 se lau e patients ia po tatou tangata mai foi ia ua mawhai o na au atu ai ia le au nanga o le nei ofisa. DME available services. O itua inga mea whaingaluenga whafo mai nei ia o lo awanoa I le taimi nei le mato ofisa wale au nanga. Yeah, as you all can see in the back, o le umalawa ia tato equipments, po tato medical supplies. Ia iai wheelchairs, ia le moinga whale mai se tulo. Ia mawhapea I si medical supplies o lo itua le tato, I tua atu le tato whale a e se taimi o na tau sawalewali atu lea, ia mai mua foi. Ia I supplies o lo offer le tato provider lea mai pango the MedQuest. Medicaid coverage. Medicaid utilizes the Medicare fee schedule for DME. O le winga le fam talanga. E mulitai lava le Medicaid I tau fatulanga o le Medicare. Ia I tau o mea ia o tato supplies ia mai le afoi. Mai le tato provider e ia no fua whata vale o moenga ia e mulitai e lava le nei ofisa I tau whatulanga le Medicare Some DME requires co-payment. Winga feo lea fam talanga. E iai supplies le mawhai o na cover le afoi, le Medicaid. I mean, ia supplies le cover a koa le afoi, le matu officer. Ia require le co-payment mai le patient. Ele se payment ke le, ia penga le lua se fulua, ia e mawhainga cover le patient. Ia o le afe tā la e alua ngai lunga, e kawa uma lava e le afe le matu ofisa. The enrollment process. Lisi lea tūlanga tā ua lava o le processing o le afe le tatou service. The first step, LPJ or DOH doctors issue prescription to the patient. O lea pepa wha mau mai le afoi, mai le fo mai o le LPJ, ma le ofisa o le soifua maloloina. E mawhai ona waai ele matu ofisa, o le atonu le equipment le request le patient, po o le wheelchair, o le moenga, ia whapea fo ia se tulo, ia mea fo suka, ia a mawalo le prescription. Moving on to step 2, patient enrolls at the Medicaid office. E maua lole le prescription, ia ona e sa vali atu lole i le ofisa. E whai e lo restala i ma watu ai o required documents, e se taimi o i luma, ia ona whai lo atu lea. Moving on to step 3, Medicaid screens and approves DME requests. Ia o taimi lea, e whai e le review a le division head, whai le review on matu ofisa, po le mea e anga waa le patient, ia pe mawhai foi le ofisa o na cover le equipment le request a koe le patient. Moving on to step 4, DME providers schedule delivery and bills Medicaid. Ia e approve lo le Medicaid lo request po lau whātau sanga. Ia o na schedule lea e si vaenga lea le request. Ia le kiliva atu o lau equipment or supplies. Ia wale lau whatar sanga. Moving on to step 5, Medicaid conducts visual audits of DME delivery. O the visual audit, ia awai atu ai si representative ale Medicaid ina ia verify o mawhai ona kiliva le equipment o kiliva sao i le patient. Eligibility. Lisi foi lea pe ona sau noa atu ia Austin. Lisi lea mea tā ua lava. Oni e au na tatou sila fia, wale tatou service. US nationals, yo nasionale o Amerika Samoa, o yo o Amerika, tangata ia na whanau nei. US citizens, tangata na whanau I whafu. Ia lawfully residing non-US national citizens under 21 years old. Io nei tamaiti ia o loi lalo le lua tasi tausanga po le a lava le status a le residency. Ia italia uma lava nei tamaiti. Lawfully residing non-US national citizens, pregnant women. Pei foi ona whai atu le a foi le ia tua le vau. Ia e tā ua lava nei o tātou tina mai tanga. Ia wā lava ia tātou service ia lo available on island. The important note, all must be bona fide residents of American Samoa. Meaning, you must have lived here for a year. Ele whapea e alu alau tā whaonga I whafu. E whamoe me te sau I ne toi alu e si mai. Ia ele kali ala in matu ofisa lea fui. Lea tūlanga. The required documents for children under 21. O required documents ia mo tātou tamaiti, o loi lalo lua tasi tausanga, I tauna su atu le mātua, I whaere restala le tamaititi. O le prescription, like what I mentioned before, the prescription is to verify the necessity of the patient. Either request documents or the medical supplies, they request a koe le patient. Birth certificate or passport, verify elo legal name. and updated immunization records, ia o lea documents, ia whamau ni e foi, o lau tamaiti, o po lau tama foi, ia o le enroll, o le ave whasenga i nea mika Samoa, parent, legal guardians, local ID, and legal documents. E mana o mia awha bea o lau tama, i e mana o mia lava le ID e mātua, e whai ele restala. E tutusa lava i a documents e mana o mia ne tamaiti pau lava le documents e mana o mia e nei tamaiti e awhue. The lawfully present children under 21, i o le immigration ID. E mana o mia la tole le immigration ID, e verify e lako status. The required documents, like what I mentioned before, e tā ua i o nei information, i nei a tātou i loa ai, ma malama i a documents e tā ua, o nau mai e whasawali ele blokalama, US nationals and US citizens, i e manau mia le prescription, e pei ona whai atu, o le prescription le mai le fō mai, le LPJ, i ai mese fōi le ofisa le soifo maloloina, the birth certificate or passport to verify your legal name, and 2 valid American Samoa identifications. E ai le laisine tā vale, e le voter's ID, ia pei ona whai atu FaceTime o solo, ia awha pia le ingi ID, ia le pili o le Azteca, o le pili o le ASPA, ia ina ia mawhai o nau mai, ia for proof of residency. The required documents for the Ainga Care Initiative, just like before, the prescription from the LPJ or DOH doctor, a birth certificate or passport, and 2 local American Samoa identification, including your AS immigration ID. Ia male tatu documents muli, o le immigration petition, pe ona sau no atu ia kora, o le immigration petition, o lau i ngā whono, o le document lea mai le ofisa o le immigration, e whamau ni ai fōi le status o lau ID. Yeah, and that concludes my presentation for the TME program. Yeah, manuia lava nea so.
Wow, whapitai lava le tū, that's information overload for Manuia. Austin, o te whiwhisiri nā. Mō mātou ia mana o miele wheelchair. Le anga wheelchair. If ia tau sanga e whaatani ai, e toi mau e se si mea fō, whamon mole ala sunga taita.
Ia, whawtai lava mon whawsini tina. Ia, o le wheelchair, a toa ai, ma le medical bed po moenga ia whawho mai. E 5 tausanga o lo o sau e au ngā ai. Se I vanga nā, wa mana o mia lava ona wa malepe, se I tulo. Ia ona toi mwhaina, ia ona toi apply. A o le wheelchair lava ia, a toa ai ma semi-hospital bed, le maua le tātou DME I pango. E 5 tausanga e au ngā ai. What that means is a wheelchair is good for 5 years, as well as a semi-electric bed that is offered at the DME provider in Pango Plaza or MedQuest Supplies. So what happens is oftentimes we have patients who come in monthly, yearly, to request a new wheelchair. Yeah, and most of the time we would have to involve our investigator, Matilda Cruze, to try and see if it's legit, if it's a legit reason why Leona or just will wear out, yeah, tires, say too low. Yeah, po le tausi mea le, yeah, why Leona whaaleanga ina, yeah, the wheelchair po le DME. But for your information, tina, e 5 tausanga e ang elelei ia le wheelchair, ia ato ai manamuenga. O whaamania ina lau fesili.
Whawtai lava mo malama ina o le fesili. Ai whapewhela mea o masini e se akele suka ma.
Ia o le masini fua suka, ia po le masini fo I fua I lau toto, ia e te anga vaa I lava I tausanga uma.
Ai ia mai le
Ai
prescription.
au mia lava le prescription mai lau fo mai.
Ia
Sa o le.
whaatai. Ia, o le taimi le nei, we would like to direct your attention onto the screen here. As mentioned earlier by Austin before his presentation, there is a QR code which directs you to this, where you can post your questions. Okay, so we're gonna go through the questions right now, but not all of them, because some of the questions that we see, it pertains to the next part of the presentation. So we'll wait when that time comes, then we'll address these questions. So I have a question here. Can we look at having Medicaid cover dental implants and other in-depth oral health procedures? I'm going to direct this to our Program Integrity Division Head, Matilda, to explain, please.
In regards to covering dental implants and in-depth oral procedures, we only cover dental procedures in American Samoa. So it's really LBJ and DOH that needs to build this sort of comprehensive coverage, because we would actually prefer it to be covered here due to the type of procedure it is. So unless LBJ covers it, we don't cover it at the moment.
Okay, thank you, Matilda. You know, whoever asked that question, wa whaamalia ina le tali o le fasili? Yeah, atonu wa malili e whaftai. O le isi fasili, what is the turnaround time in receiving DMEs once MedQuest receives information?
Thank you for the question. I think this is a question that is mostly asked with our division. Now, the turnaround time really depends on when we get the documents, and I mean all the required documents that was shared by Letu in the DME presentation. Most of the time, we would get the prescription, but we lack the proof of residency. Or we would get your resident IDs, but we don't have a prescription. But I do know that once it goes to MedQuest, then we will coordinate an available time. What MedQuest does is, when they receive the DME application, first they would have to check if it's in stock. If you are applying or you have been prescribed by a doctor to receive a wheelchair, there are different types of wheelchairs and different sizes. Now, what MedQuest does, if all the information and all the documentation is in order, they would first have to see if it's in stock. Now, secondly, one of our staff has to be available for this visual audit. So I guess the turnaround time, if everything is in place, I would probably say in less than a week. Am I right, Lisa and Terry? Yeah? If everything is in order, then we try to get the DME to you as quickly as possible. So that's our turnaround time right now.
Whaftai.
Po whaamania lea fasili, ila turnaround time for DME.
Tu atu foi leva noa and whai mai ni fasili. You can ask questions as we go along the list of questions we have on here. So this is the best time to ask your questions regarding the DMEs and the services as presented by the benefits team. Question here, Director, please.
Good morning.
Good morning.
My question pertains to the eligibility for the children, right? We have the updated immunization records. Now, my question with that is, what is really acceptable? Because with DOH at this time, with DOE, what they're doing together, we're called like every 3 months to update these records. And when I get over there, it's the COVID shot or flu shot, which is not mandatory. So what is mandatory to you guys?
I think,
an update?
so we're only asking for the updated immunization records, Madam Director, because it is our understanding that all students who are in school must have updated immunization records. So when you do provide an updated immunization record to our office, that is proof that your child is in school.
Are you looking at a stamp of what was the last updated
We
record?
do look at the last date of immunization. So usually, if a pia teacher will feel high school, yeah, what for ilau pepa on the immunization record. But for our younger kids, there are not that many immunization records inside. But we do try to look and we do thoroughly check for these dates. Thank you, Director. There's a question to offer to. The question that was asked, does Medicaid cover CPAP and BiPAP machines? And the answer is yes. We do cover CPAP machines and BiPAP machines if you are prescribed, if there's a prescription from your doctor and you have done your sleep study. Now, we do not cover the sleep study as of right now, but we do cover the machine that you require or the equipment that is required for you. There's a question here from Murikora, Mike.
What's the DME stands for?
Sorry, DME stands for Durable Medical Equipment. And then, so the program is called DME POS. And the service that it offers is durable medical equipment, prosthetics, orthotics, and supplies. I love it, Director.
Yes, there's a lot of fake news on the internet. And one of the things you get is, you can now check your pulse and everything online. And I have friends who do, and they use it a lot. I don't yet. But I was just wondering if it was possible for Medicaid to substantiate or sanction certain sites who could give you the triage stuff that you need, so I don't have to buy those things and prick my hand because I'm type 2, and this way we would know that they are sanctioned sites that we could use and also help us save money.
So I'm trying to understand your question. Are you saying, are you talking about our providers and you want to know who you're not allowed to visit or is not ineligible covered?
No, I'm just saying that some of the services that are provided also include stuff where you check your blood pressure and some of the other stuff, your sugar and whatnot, that can be provided by you guys. And I'm saying online there are such things, but I don't know if they're good enough, true enough for me to use. But if Medicaid would look into it and say that American Samoa, these are the ones we sanction and you can use. Thank you.
Okay, so most of those online things, we do not recommend you utilize them. The best source you can actually come to our agency and ask for our actual official provider network. There are some what's called the U.S. Department of Health and Human Services does have what's called a provider exclusion list. So it does tell you who is excluded from receiving any federal dollars. And if you have any questions of any provider you're not sure about, you're always free to call our agency because I have access to that list. That goes down even to the state level. So when you're not sure about a provider, like I don't know them, this is their NPI, you have to give me some sort of information so that I can check them to see if they are truly a true provider or some sort of fraud scheme. Okay, I hope that helped.
Thank you very much for the opportunity to ask my question. I'm a United States Air Force veteran. My question is, what is the income threshold a person must have in order to qualify for Medicaid? Can you share that with us? Thank you.
Thank you for your question. So regarding income threshold, so how Medicaid does eligibility, we do what's called presumptive eligibility, as our Medicaid director has stated. So how we based it is actually 400% of the federal poverty level. So basically, whatever is the current poverty level, times that by 4, and you get the income threshold. But currently, we don't actually check for the income threshold because it's presumed that most American Samoan residents are not making that income threshold, which is really true.
I'm from Department of Search and Rescue. What measures are in place to improve access to healthcare services for Medicaid beneficiaries in remote areas of American Samoa?
Sorry, can you just repeat your question, please?
What measures are in place to improve access to healthcare services for Medicaid beneficiaries in the remote areas of American Samoa?
Thank you for the question. So some of the remote service areas in American Samoa include the Manua Islands. And one of the services that we do offer at this time is a medevac, where we work together with Department of Health to evacuate our patients when they need emergency medical attention. Now, as far as in the rural areas at this time, we do have our Department of Health clinics that are available that we can utilize for the people that are living in rural areas. But at this time, we don't know. We do encourage the public, though, and also other potential providers that can help with these with services outside of the Tafuna and industrial area to come forward and provide these services where we can bring you on as providers and then possibly pay you to do that service. But at this time, we don't have any services available for the rural areas.
I would like to add on Austin's statement. We do work closely with the Department of Health in all the community health centers, and we push for preventive care. And that's because we don't want our patients to end up in an acute state when it was something that could have prevented, from the patient getting to that point. So it's just working together and pushing, having our Medicaid beneficiaries visit the CHCs across our island and in the Manua Islands. And that's important because it's free. Well, it's free to the public, but it's not free to Medicaid. But you can go and see your primary physician at these CHCs, and you don't need to pay anything. That's what Medicaid is covering for the beneficiaries.
Hello? Okay. Me again. According to you, Mr. Asiata, a non-eligible person is lawfully residing non-U.S. citizen, but over 21, correct?
Sorry, what was the?
According to you, a non-eligible person is somebody that's lawfully residing non-U.S. National or non-U.S. citizen, but over 21, correct?
That is correct.
Thank you. Now, I want to go back and how we can, you're asking for a second ID for some of these people who are, who've been here 20 years and on the CA situation. I ask that you please recommend, work closely with immigration, because kele o kaini, o maliul makai, and nobody will give this person, this woman, this old man, verification they've been here 20 years and law abiding. And I would like to see you recommend to immigration, everybody over 20 years, issue a certificate that says they are law-abiding and whatnot. Thank you.
I've taina va mole fautuanga o le ata mawhaifo i ngā lue whaatasi ma le immigration ina ia maua ia immigration IDs ana I tātou tangata nu. Honourable?
Hello, Siri Famulmo.
Okay, Fatima.
Okay. If I have a problem with cataracts and the procedures can be done here at LBJ, but I would request to take it off island, will Medicaid do that, or do I have to get permission from LBJ?
Thank you, Fatima, for the question, and that is one of the most asked questions at the Medicaid office. But what we should understand and know, the off-island Medicaid referral program exists only to provide coverage for medical health conditions that cannot be done on island. So anything that can be done on island, we will cover it at LBJ or Department of Health, but we will not refer you off island if it's not being referred by the LBJ.
Yeah, and seeking for a second opinion, and that's like a personal request from the patient, and I'm sorry, as written in our state plan, if it's serviced here, available here, you must have it done here. Thank you.
Now, I do want to add, there are services that are also available on island, but for some reason, maybe the equipment is out, or for example, the CT scan is down. Now, for those reasons, although an offering name, but if the machine is down, we will honor the request to be referred off island. But if it's a cataract, be on the noa yeah, Ms. Nankildi, yeah, ava pe olema faina fai lava ine, yeah, ele honor in the office, yeah, the request.
Question?
Julie?
Sorry, so going back to one of the questions that was asked about having Medicaid cover dental work here on island, I know the answer is yes, it has to be done on island, but only LBJ and DOH was mentioned. Can it be done if there's a private dental place locally? Can it be done there, and will it be covered?
Thank you for the question. So yes, we are expanding our services, and we've just submitted, well, our deputy here has submitted a state plan amendment for additional dental services to include local private practices such as Island Smiles. And so that is in progress right now. It hasn't been approved yet, but that is, I mean, to answer your question, we are encouraging more private practices to come here to American Samoa so we can expand and also reduce the burden on our hospitals and DOH. In addition to that, we just got approved the state plan amendment for dialysis. So Hope Dialysis is now going to be an additional on-island local provider. So clap hands for our deputy who had submitted 2 spas that were approved. Okay, thank you.
Gloria, Fatua?
Se koe kulkulia ko ala ofisia. Ava pe ala la mga oa auia anu o I fafo e whaela o procedural cataract. E mawhainga accepte Amerika po o ngusila la ulaku le la ulaku ai.
Ia hautai lava, ia whaamaruru atu tina, pe ona saunoa atu, ia sui whaatonu, a whai lava wa e manao, ia o le personal reason, ia lona winga, e le taria ina le Office on Medicaid, e le eifo se coverage mo. Oi, ia atonu se teimi o I luma pe atu e tele nisi a tato selen, ia ona expand ia kawai, ia ni personal requests, whaatai.
Just want to jump in here real quick. I wanted to sort of answer the question from the young lady in the front. We will be presenting at 2:30 today on home community-based system, and money follows the person. That's more in the rural and remote area in addition to American Samoa. So please don't go anywhere, everybody.
Okay. Honorable Rep? Okay. Fatua? Gloria? Okay.
Langima, Andrew Fawan Molea,
if we are, or when we are successful, I know you will be, with the dental, expansion of the dental services, this private dentist, he does ortho and, you know, special services. Would that be covered, especially for the children, like the chip age? Mole.
In fact, the spa is for children and orthodontics is covered. So hopefully we'll hear from CMS in the next couple of weeks or couple of days. And as soon as we get that out, we will set up a date and let everybody know when that service is available to our children. Thank you.
Ting 1, 2, 3.
Umalosi tina so umaina irvanga le SAR.
I know in the past we couldn't get our monies due to lack of our local match. So my question is, do we have a backup plan? Because I know it's supposed to be from our local government, but just asking because now I saw somewhere that it used to be 60, but now it's what, 58 or something along those lines. I'm just asking if we have monies for the local match, so we'll be able to continue with all these wonderful services moving forward. Thank you.
Yeah, as a matter of fact, in FY 2025, our local match was increased. So that is a big help for the Medicaid program. But the Medicaid program has also learned from the past. And so we have, we're now managing the funds more closely, and we're looking at, so these services are being managed closely. That way, in the sanga. Did you want to speak on it?
Yes,
Director?
I did want to add to what you were asking. We have spoken with the governor. He is aware that our funding of local match is not technically in a secure source fund. Right now it's coming from part of the government that is not secure. And so we are looking to find other ways of where we can pull that funding. The FONO has appropriated $6 million for this fiscal year for us, but that still doesn't allow us to draw down all of the funding. So we have about $92 million allocated to us through Medicaid. In order to draw down that fund, according to the federal medical assistance percentage, we need close to $30 million to actually access that. But we've only been appropriated $6 million. And so that comes down to the revenue that our country is receiving. So we're trying to be a little bit more innovative as to how we can make up the local match in order to draw down more funds. So to your question, do we have a backup plan? We are discussing ways of getting more secure funding for this so that we can draw down more funding. Hope that answered your question.
SAR, you get a mic for the team here?
I have a question, please.
Am I aloha? Yes, SARS, and then to Atlanta Noi doing that.
Oh, thank you. Could you provide clarification? Does LBJ also have an off-island referral program that is separate from Medicaid, or is this the same program? And what is the procedure for a LBJ doctor to make a referral? Does the referral, I guess what I'm asking is, does the referral automatically go to your office if LBJ cannot provide the off-island
Thank you for the question. So this is one of the questions I wanted to hold off until we've presented on the off-island Medicaid referral. But the quick answer, and I'll give you the long answer later during the presentation, the quick answer is yes. LBJ does have their own LBJ referral program to the states, and then Medicaid's referral program is to New Zealand and Hawaii. Now we do share, and I'll share the process later on in the next presentation, and it'll be much more clear to who who is eligible for LBJ's referral and who is eligible for the Medicaid referral, if that's okay with you, sir.
I took advantage of the Medicaid program about 3 years ago. And I went through the system of getting a local doctor review and recommendation. I have to say it was pretty good. There was just a slight delay, but I finally got it. Now, what I haven't heard you speak about is that the person that's qualified because they're a national or a U.S. citizen, that they should have, besides Medicare for retirees, but they should have some of their own insurance to help defray the cost. This isn't all free. They play a big part. But a kauka yellow insurance that back up and take care. I had my eyes done and I had surgery. And those are expensive procedures. But it was all covered through Medicaid and my own personal insurance, medical insurance. So beware of that. So my question is, do you advise our clients who are eligible to ensure that they do have their own personal insurance policies in place and active to also help with the cost itself? Because that's what happened to me as a person that took advantage of the Medicaid. That's just my first question. So you go ahead and answer, and I'll say my last question.
Yeah, I'll go ahead and start answering this question. It does help when you have your own personal insurances on top of your Medicare insurance. That way, it lessens what Medicaid pays. But we do not advise that you have a Medicaid in Hawaii, because you cannot have Medicaid in Hawaii and also apply for Medicaid in American Samoa. Both Medicaid, Hawaii and American Samoa, come from the same pot. Now, what you will be in violation of double dipping into two different Medicaids, but from the same pot.
I'd also like to stress out the importance of knowing and understanding that Medicaid is the payer of last resort. This means if you have Medicare, you have a VA, you have other private insurances. So when we get that cost from the hospital, Medicare takes care of the 80%, whatever percent that is covered by your private insurance, then what's remaining, that's when Medicaid picks up the bill. Medicaid is the last payer, is the last resort, payer of last resort. Thank you.
I also want to emphasize too that in order for us to cover your accommodations and your travel, we must pay part of your bill. So if you want accommodations and any sort of transportation with the off-island medical referral, we have to be involved in your medical referral. So if we do not pay at least even $1, we cannot kick the other services in too. So please take that also into account.
Second question, just before I do my second question, I have to make a comment about the accommodation, realizing we're talking about cost. The accommodation that they offered to us was not up to standard, in my opinion. And we weren't asking for a high-class hotel, but we appreciate that we had accommodation. Thank you very much. Second question, realizing all that's happening right now, potentially, the federal government may slash Medicaid. They're already dismantling the Department of Education on the federal level, and the states have to come up with their own resources to educate their children. Can you imagine what's going to happen to American Samoa? So I'm asking, Medicaid, are you preparing for the worst of the weather to come? Thank you.
That's why we're here. We are preparing. There are decisions being made at the federal level that are out of our control. And so we are acting right now, business as usual. We have the funding. They haven't stopped it yet. And so we are proceeding and moving forward and getting our people the care that they need with the funding that we have. If they do, for whatever reason, make changes to where it impacts Medicaid, we're just going to have to respond. Like our government, as you are aware, with the new administration, inherited a government with a $55 million shortfall. And so we are in cost containment measures as I speak. Every department is tasked with saving. And so with healthcare, it's a little bit different, right? Our people require health and services on a daily basis. And so this is funding that we can't stop. We don't want to stop, but we are moving ahead until we hear otherwise. Okay, so that's really our plan. We are at the mercy of what is happening in Congress. And so I would encourage all of us to get engaged and be aware, because right now, even them, things are uncertain, things are changing on the daily for them, and we are working quite closely with our counterparts to understand how to respond. And we're grateful that our Faipules are here too, to understand as well. We're all getting it at the same time, getting the information. But if you have ideas and where we can, find alternatives for local matching, find ways to increase our drawdown, find other services that are available to us that just aren't in our state plan, we welcome that conversation. We're here to collaborate. So thank you for the question.
Hey, ma'am?
Yes.
And then Julie after?
Yeah, hi. I just have a quick question about, is there like a cap on DME coverage? So let's say, for example, a student with disability who needs custom wheelchair, because they are much more expensive than your regular wheelchair. So when we're talking custom wheelchairs, they're like anywhere between $6,000 to $9,000.
Sorry, we can't quite hear you from the stage. If you could just please repeat your question.
Yeah, I was just wondering if there's a cap for DME coverage for, let's say, a student with disabilities who need a custom wheelchair. Because like I said earlier, they could cost anywhere between $6,000 and $9,000 compared to your regular $300 standard wheelchair.
Now, as Letu'u mentioned in the DME presentation, American Samoa Medicaid Office, we follow the Medicare's fee schedule offered in Hawaii. Now, whatever is covered by the Medicare fee schedule in Hawaii and the costs, that's what we cover here in American Samoa. Now, there are some equipments that require a patient's co-payment. So yes, there is a cap for some of the supplies and medical equipments, but I can assure you it's not much that you'll be paying out of pocket. For example, I believe the commode, there's a $50 co-payment if the prices haven't gone up yet, MedQuest. But for the wheelchair, because there are different kinds of wheelchairs needed, but I do think the standard wheelchair is covered. Chile? Yes. The standard wheelchair is fully covered.
Chile, what about customized wheelchairs? Customized wheelchairs.
The full electric?
Unfortunately, electric wheelchairs aren't covered only because there's certain guidelines that we're required to go in, like measure the house, check everything. And I'm only one person, I can't really do all the houses. And the second thing too is regarding customized wheelchairs, yes, we do cover it, but it needs to be itemized. So our supplier needs to itemize down to the bolt, whatever is the medical coding is required. So it is covered, it is eligible for coverage, but we only have one supplier.
Julie, yeah, and then there's a question here.
Yes, this is regards to what the director had said. I think I'm jumping the gun because I didn't actually read the entire state plan, but is there a requirement, I do know you guys are federally funded, but is there a requirement where you guys cannot use local cultural health practitioners, as in Fofo Samoa, Failele? Yes.
until last year. Chile, can you answer that? More until last year, I'm a full-time.
Sorry, Tile.
Sorry, short answer is no. But Medicaid is able, if it was available, to cover acupuncture. These are considered optional state plan amendment benefits. So things like caregiving, adult daycare, acupuncture, these are considered optional state benefits, which it's up to the state if they want to cover the services. So I hope that helps.
Thank you. Thank you.
Mr. Maunga?
I'm a veteran, and I wanted to ask if Dr. Early, my primary care physician's prescription is honored, if he were to write something for any of the veterans. Dr. Annie, are you here? Do they recognize prescriptions from our doctors at the VA?
Thank you for the question. At this time, the only prescription that we are accepting are from LBJ and DOH because they are our local providers.
Our doctors aren't on your...
Sorry?
The doctors from the VA aren't on your as providers?
At this time, they are not. Chile? Chile can help clarify on the requirements.
So in regards to the VA, that is a separate entitlement program that covers the VA beneficiaries, but VA beneficiaries are what are also considered, like we like to call, dual beneficiaries, because they also have their VA and TRICARE benefits. Whatever VA and TRICARE is unable to cover, we would usually come in and cover if it is eligible under our state plan.
But do you recognize their prescriptions as doctors?
So for Dr. Early, so the only prescriptions that we cover in terms of medicine is at LBJ. So it's something that LBJ and VA need to have some sort of cooperative or like some sort of way they can use their EHR. So that's something that you'll probably have to ask CEO and CMO about.
Thank you. And I have a second question. When you go to ER, when you sign in, they give you a Medicaid or Medicare form to sign at the bottom with all the treatments and procedures left blank on top. When you receive this form, does it have, do you check the procedures that we actually got? Or do they usually add more?
Oh, so in regards to LBJ Hospital, our payment methodology is very different than how we pay DOH, how we pay other hospitals. Now, the unique thing about LBJ is that they're able to draw down full federal. And the only reason why they can do that is because they are being reimbursed for prior year's cost. So it's what we call the Certified Public Expenditure Payment Methodology. Now, what happens is when the doctor inputs his notes, he sends that encounter goes to the EHR system, which billing looks at and does the coding. And from the coding, it goes to finance. And so what they use, from the finance people fill out what's called a Medicare cost report. Now that Medicare cost report is how we pay. So when that form is filled out, Medicare looks first and audits the form and says, okay, out of all, like maybe, this is just a hypothetical, LBJ says, you owe us $50 million. Medicare looks at it, audits it, and says, no, actually, we only owe you 10, and Medicaid only owes you 30 million. So we don't actually look at the individual bills or the individual encounters. Medicare does that for us. But we are looking in the future that when we develop our own, what's called Medicaid Managed Information System, we eventually have to see it down to the Band-Aid. And that is something that Congress is wanting us to do.
So there is some audit taking place?
Yes.
I got a surprise bill from my wife for $700 ambulance transportation, which never happened. So,
is this locally?
Yeah, locally. I understand now that they're audited. Thank you.
Yes. And if you ever receive something like a surprise bill or something from LBJ or DOH or any of our local providers, you're more than happy or more than welcome to come to our agency so we can vet and ensure you have to pay the bill or not. Because sometimes what happens is it could be a billing error on their part, and we can help rectify.
Sir.
Yes, thank you. I represent a provider. My name is Francis Andre Glaudet, and I represent a company that would like to come on island to provide services such as telehealth services, services to individuals who are discharged from the hospital, and no one is available to go to their homes to see these individuals. Now, the problem is that our providers who would provide health care to individuals who have Medicare, we need to get on the list of the ASG contractors in order for our providers to be reimbursed for services we provide. So is there a way for our providers to get on the list so that we can provide services to the American Samoan population, which right now we cannot because we're not on the list? How do we get on the list to provide these services?
Thank you. I'll give the mic over to Tile, as this is a provider enrollment question.
So when you're talking about ASG contractors, are you talking about being a part of our Medicaid provider network? Yes. Okay. So right now, we are actually looking into covering telehealth services because currently in our Medicaid study plan, we are unable to cover telehealth services. So that's something that is going to be in the pipeline for us to amend in our state plan. And when we do make that amendment, we will let you know. But right now, we do not cover telehealth services, but it is our priority because that's something that we need in the territory.
Thank you for the question. Also, if you are trying to establish a company here or private practice, you'll have to, I'm sure you're aware, go through the Department of Commerce to establish yourself as a bona fide business here before we can even look at your company or your services as being an extension of our Medicaid services. So I would do all of that legwork and homework before you come in and try to present or propose the opportunity to partner with Medicaid.
Okay. So moving on to the next question we have here is, Tile, please wait there. Does EMS qualify as a local provider?
They could, but how, well, yes, they are, but they are being covered through LBJ, and I know they don't want that. So what I recommend for EMS is, under the state plan, you are eligible. We can cover you. Only problem is we have to fix a payment methodology for you. So that's what's going to take time. But in the meantime, when you're building your provider application, we'll need a lot of information regards how the department is set up, what types of grants you receive, what does your grants pay and what it does not, because we have to make sure it doesn't pay any of the, when we see the patients. And another thing, well, I'll be going down the list tomorrow because that's going to be based on provider enrollment and provider requirements. But yes, you can be, you are eligible in the state plan, but we need to make a payment methodology for you.
Are hearing aids considered DME?
No, short answer is no. It is a separate benefit. Currently, the only way you can get it covered is at LBJ Hospital, but we're looking to amend that since we know there is a local provider.
Thank you. We have a question here about AA and C only. It says, why only AA and C only? Are you looking into covering BA status?
Thank you for the question. So first of all, this is an extension of coverage that we're offering for our permanent residents as well as our one-parent residents. Now, how did we come to this conclusion? We try to mirror what the US does. Medicaid in the US, they do cover US permanent residents, and these are green card holders. who have lived in America. Now, the only difference in a U.S. permanent resident and an American Samoa permanent residence, what's standing, from us and covering our American Samoa permanent residents are the difference in our immigration laws. And that is, and that is why that's why CAs are ineligible for Medicaid, because they are not similar to U.S. permanent residents when you look in the U.S. immigration laws. And that's why we wanted to extend this coverage, is to include American Samoa permanent residents. Now, the rationale behind it is these people these residents have been living here for at least 20 years, have been working and paying taxes, and so they deserve to be covered under the Ainga Care Initiative. The AAs, or one parents, these are residents who have parents that have lived here and were born here, also have worked here, paid taxes, and whatnot. Now, I do know the BA status is a wife of an American Samoa resident, American Samoa national. And at this time, we don't cover because it's I like to say and think that if we extend coverage for BAs, you can come yesterday, be a BA, and then you're now covered for Medicaid. But we want to make sure that you have the 3-year IDs, immigration ID, that further proves that you've been here at least 20 years. If that makes sense to whoever asked that question. Langi, you can probably...
Yeah, and just keep in mind, as Austin mentioned earlier, this Medicaid is a federal, state, local program. So for the AAs and the CAs that we are currently serving right now, we're not drawing any federal funds for them. This is all 100% local. And we want to keep it that way because we want to follow our state plan until a time comes when Congress or the US would like to extend coverage to American Samoa permanent residents to draw the federal funds, then that'll be great. But as of now, the Ainga Care Initiative is fully 100% local. There's no federal funds involved with payments.
Now, if I could add, there are some BA residents who have come to the office and they've inquired because they have been living here for 20 years. Now, what you can do is you can go back to the immigration office and get your CA status, and then you will be eligible for the program. So you're just getting rid of the B and you're adding the C, and then you'll be eligible for the Ainga Care Initiative for all local services.
Can patients receive electrical bill assistance due to power accumulated by electrical beds from the DME program?
Sorry, that is why we give you semi-electric beds. So if it's too much for the electricity, there's a manual crank to. Unfortunately, we wish we could, but I'm sure CMS will look at that and question that. We really wish we could.
We also have not received any complaints yet for beds or houses that have been destroyed due to electric outages. But I do remember when I was coordinating DMEs in 2019, 2020, the semi-electric beds that are provided comes with the power surge adapter, so there is no reason for that to happen unless it's the wiring of your house. But if it does happen, I do advise that you report it into the Medicaid office, specifically to Matilda Cruzy, and she will help you with your inquiry. Thank you.
The next question, now that we have local match funds, what is the status of the patients who were waitlisted last year?
Thank you for the question. So all our patients that have been waitlisted since second quarter of FY 2024, which was last year, March, all the way up until September. We sent out a letter in the beginning of fiscal year 2025, that was in October, sent out an email to all LBJ referring physicians, as well as the board, that all these referrals have to be updated, because all referrals since the closure and the hiatus have been outdated, and that is what will be required by our medical providers off island. When we send the reports, they would need an updated report. So I can honestly say that majority of our patients that have been waitlisted have already gone to New Zealand or Hawaii and have gotten the help that they need. But if you are a patient that have not gone yet or have been waitlisted and you didn't get your new referral from LBJ, I do encourage you to go back to your referring physician. That way we can get the most updated and accurate information, medical notes for your referral. Does that, I think that answers that question. Thank you.
Oh, yeah. So we have, it's not a question, but it's a comment from Gertrude Yuli Sala. Initiative to abrogate obesity among nurses, policemen, and school teachers should be a Medicaid public health ongoing initiative. And that is true, and it's not just for these professions, it's for everyone, for all of us. And that's why we want to work with you the next 3 days. Give us your ideas. Give us your thoughts on how we can improve our wellness, checks. Did you want to add, Director?
Yes, thank you, Langi. We also are, prior to me coming, the team has implemented a wellness program, and that is going to be shared or talked to with the Department of Health in terms of preventative care. There are a lot of services that Department of Health actually offers to get a baseline of where your health is, doing your blood work, checking your blood pressure, doing all types of services. And sometimes there are services here that are not, that should be here that are not available. But Medicaid does want to work with the Department of Health to implement a wellness program that can help with this comment here, this statement. And so, stay tuned. I hope Department of Health is anxious to work with us, because I think we can provide a lot of great options to our people to get a full workup on where they're at and a baseline, and understand what exactly is going on in their bodies and how they can, how they can get the services they need to get back to better health.
Thank you. We have our last question here, and for potential service provider applicants, how do we go about in seeking a local match from our local governments?
Okay, so for potential service providers, I think the best way to do it is ask your faipule. Tell them you're trying to provide, you're a potential provider, trying to, wanting to be a Medicaid provider. We do, right now, under our local match, we can cover some services, but there will become a limit where CMS will be like, you're covering 50 new providers, but the same match, something doesn't match. So it is helpful for us when you do advocate on our behalf to help increase our Medicaid local match subsidy, because that does help us increase and improve the services. But I will say this question really should be directed to your faipule, your senator, and my Medicaid director and governor.
Thank you for that, Tile. So that concludes our set of questions and answers for this segment of our part one of the presentation. And would like to turn the floor over to anyone else who would want to say a comment or additional questions before we go on to our break and networking lunch.
Okay, I don't think there are any questions for this time, but we'll reserve some of the off-island Medicaid referral questions that we received for our 12:30 presentation, where we will be presenting about the off-island Medicaid referral program to Hawaii, as well as the off-island Medicaid referral program to New Zealand. But at this time, I'd like to invite everybody, if we could just please take a group photo in front here, right in front of the screen, before we move on to our networking lunch. Mole lava, me tato wafia, bim faina puena tato wata group photo. Yeah, fai mapine fa amau ne nei fo ia so mo the tato summit fa type. Music.
Team, can I get help in the front here? Can I get some? Hi. Can I get some team? Mole se mai tato no foa. Fatulanga mai no foa ina ia. Fai ona poena le ata.
that applies to each and everyone on each table. Are you ready to mingle? I can't hear you. All right, let's get that adrenaline pumping before lunch hour. So we're looking for the letter X. The facilitator will mark off each box as we go along. And the object is to get to know your peers around you or the other attendees. And if you're ready, does anybody have a question before we start? Does every table have one? Yes, okay. All right, then let's get started. Did you pick your facilitator already? All right, but before we do so, can we get up off our seats, please? I know you've been networking, but let's get that adrenaline pumping before that big lunch. This is a health summit, so let's get that adrenaline pumping before we dive into the big lunch. All right, let's put our hands up, arms up. Let's give it a shake. Shake, 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 shake. Arms forward. Let's give those puppies a stretch, like so. Doesn't that feel good? All right, next arm. Next set of fingers. All right, hands up. Give it another shake. And let's slightly bend. Slightly bend. Let's touch those beautiful toes. Touch them beautiful, crusty, beautiful toes. All right, up slowly, up slowly. Arms up again. Take a deep breath while you're up there. Breathe out slowly, and let's have a seat. Thank you, thank you. All right, let's get started. So we're looking for the letter X. The facilitator will ask each one of you on each table and to get to know each other. What do you do on a daily basis for your wellness every day? If it doesn't apply to you, move forward, move to the next person. The first table that wins within the 5-minute time frame wins. All right? So we're looking for the letter X. The facilitator will ask each and everyone on each table to get to know each other, get to know what you do on a daily basis for wellness. And then once you completed the letter X, you win. All right, let's get started. Sorry, go ahead, director. You are more than welcome to use that free space, just for now. All right, and time starts now. And Jen will let you know once your time is up. Are you a person that wakes up early in the morning? If the answer is yes, please go ahead and mark that box. Are you a person that loves to eat taro? Please mark that box. Just kidding, there's no taro on that. We're down to 4 minutes. Are you a person that meditate on a daily basis? Don Pepelo. We're on to 3 minutes. We're looking for a letter X. Letter X. Yes, yes, yes. Are you? Oh, and we have a winner. Please yell out bingo. Bingo. All right. Did you need more minutes? You're more than welcome to take the sheet home. We have more sheets here if you want to congregate with your family later on today. You're more than welcome to grab one. But we have 2 tables that are our winners today. Nemo, please verify. We have a winner? All right. Please give a round of applause for our winning table here. Can somebody verify the upstairs table, please? Yeah, can you verify for us? So we're supposed to be calling out the boxes that you've X'd out. If you could kindly do so, Miss Julie, for your table. Winning table.
Okay. Hello there. Hi. Hi, my name is Julia, and this is our team here. Okay, so the first box is wake up early. Yes, all three of us, we woke up early this morning. Going down diagonal, listen wholeheartedly. We all agree that we listen wholeheartedly with our hearts. Yes, listen with your heart. Okay, there's a free space in the center, and then right next diagonal, get lost in the flow of doing what you love. Yes, we 100% get lost in what we do. And then the last one is get a good night's sleep, 8 hours. We all agree that we have a good rest.
Do we verify this bingo audience? Do we? Yes or no? No. Who gets lost in doing what they love? Do you get lost? Okay, we have one more paper. One more paper from our ASCC students.
So are we another winning table within the 5 minutes time frame? Yes or no? Yes, all right.
Okay, for waking up early, that was me. For listen wholeheartedly, get lost in the flow of doing what you love. Get a good night's rest. Get a good night's rest.
Sorry. So we also have skip sweets. Love fully. And then take time each day to reflect. And then healthy snacks breaks. Okay. Okay, so the other line, wake up early. Oh, we already did that. Okay. I think we should be done.
Thank you.
Can we get 2, 4, 5? 5 winning prizes for over here. Question? Congratulations to winning tables. Just wanted to ask if we share on our table, do we get a prize as well? Thank you. Thank you to our community. Thank you so much. So, Director, did you hear the question from that table?
Of course. I say yes. Okay, ladies and gentlemen, thank you so much for being patient. And we want to thank our sponsor for the food today. Let's give a round of applause for Local Delights. I think they did a fantastic job. And we challenged them to bring us some nutritious options and make their presentation colorful. And they've exceeded our expectations. So thank you so much, Local Delights. Are we ready for lunch? Okay, I'm going to allow Aussie to offer a prayer for our lunch, please.
Tato talo. Le tola mātou ta māsi siri e se wa mātou te tā pāna wa fio le nei tūnā. Sula ina lo walofa malo wanga le wa mai ai le amatanga le nei fo I wha moe moe. Mātou talo o fuaratino wa lau lauina le a mātou a ai nei tūnā. Mātou talo ia wha maina. Ia ma wha pa ia ina mo le mātou wha o ngā ina. a mātou a ai fo'i mo mātou maoona ia manatua pea lau fio ma le tongiola na e saunia e ala ia Iesu Keriso na ana mātou talo tātou ma oero mātou atu e manui e toenga le nei aso ono lo lava swafa Iesu. Amen. One thing is clear, we do work together with the LBJ in terms of getting the referrals. All referrals come from from LBJ. The difference is anyone can be referred by the LBJ referral program. Everyone, whoever needs services that are unavailable here on island, they can be referred by LBJ. The only difference is LBJ can refer you to anywhere Hawaiian Air travels to. For example, if you need assistance in Utah, LBJ can pay for your air transportation all the way to Utah, to Seattle, to Hawaii, wherever Hawaiian Air flies. And that's the only coverage that LBJ offers. It's just air transportation. Now, when you arrive at said state, whether it's Utah, wherever in continental US, or even in Honolulu, you are responsible for your own medical bills, your own accommodations, your own ground transportation between appointments and hotels, wherever you may be staying, whether it's relatives or whatnot. The only thing that the LBJ referral program covers is transportation, air transportation. Now, they cover 100% of air transportation for patients, but they also have a discounted fare for the escorts or the caregivers that are traveling with the patients. Now, that is LBJ's referral program. But on the screen here, I have the Off-Island Medicaid referral program. Now, the Off-Island Medicaid referral program, as mentioned earlier, exists to provide medical assistance for services that cannot be done on island. For example, we currently don't have an MRI machine. You can be referred to off-island to get the MRI done. Ophthalmology services, we can only do so much here in American Samoa. Cardiology, orthopedic, that is why the Off-Island Medicaid referral program exists. Now, everything has to be medically necessary, and it has to be a service that is unavailable on island. Now, there was a question earlier. Now, that is not an off-island referral, Medicaid referral. That is your own personal will. You don't want to utilize the services available here at LBJ or Department of Health, but you want to seek a second opinion or other opportunities off-island, you are more than welcome to do so. However, and unfortunately, the Medicaid office cannot cover such personal requests. Now, we do have two off-island Medicaid referral destinations. One, primarily, we refer all our patients to New Zealand. So whoever is eligible for a Medicaid referral, and we will get to eligibility in the next slide. If you are approved by LBJ, your referral has been approved by the LBJ board. It comes to our office, we screen, the benefits division screens for eligibility, and you qualify for the service. We will primarily send your case to New Zealand. Ole Mafuanga, New Zealand is our primary off-island medical provider. So mo itato malava asause referral ide office on Medicaid, ya o se service mana mia na malanga so ya tsunu e mamao. Ya ilo ato the office te anga va on a lafo no leo lo case in New Zealand. Secondly, we also have a Medicaid referral program, off-island referral program to Hawaii. O Hawaii, este whainga le prokalame Hawaii ma New Zealand. Hawaii is designated for our Medicare patients. Tangata anu Amerika Samoa, whanau Amerika, I lato e anga vaa, e umia na insiua o le Medicare, o lato sa whainga wenga, lo watani saunga le mu, wa ye lato Medicare, po lato fo I wa whaamalo lo mai ngad wenga, retire mai, or have disabilities. Those are U.S. national citizens e anga va'a mo le Medicare, we send your cases to Hawaii. And the reason being is we want you to utilize your Medicare insurance in Hawaii. Ia pe ona fa'a malamalama atu. Medicare insurance usually is out Part A, and there's a Part B. Part A being inpatient and B, outpatient services. Now what happens when we send your case to Hawaii as a Medicare patient, Medicare, your primary insurance, picks up 80% of your medical bills. Te lele fsosoani, ire tanto prokalame Medicaid, pe afa pe oil o se tangata nuu, fanga singasia ai yaile inisiwa lea o le Medicare. Ia, o le duas fulula pasene nen tau fa malamalama to senua solo. For if you have any other secondary and third-party insurances, if ave ese marvanga na, o le pasene tatoi, o le pasene la na pick up at office on Medicaid. Whether it's 20% or less, the Medicaid office steps in. Being the payer of last resort, we pick up your bills de tutoi mai ilau medical I Hawaii. There are two types of patient referrals. There's an emergency referral, and then there are non-emergency referrals, or non-urgent. It's an LBJ term. It's an urgent case, it's a non-urgent case, or it's an emergency case, or a non-emergency case. The definition of an emergency case is, and this is taken straight from our Medicaid state plan, it's an immediate catastrophic injury caused by an accident, putting a patient at immediate risk of loss of life, vision, or limb. Olona winga, an emergency case, o se case wa manao mia lava le fa'alati nati ona avatsu I fafo. Ona o se fa'alave lave fa'afu se I watu lai mai. Fa'ateita inga. O se tangata sa whaingad wenga, I will pa'u watu lalo if you, a child falling from the second story of a building, that's an emergency. You getting into a car crash on the road, God forbid, but that's an accident. That is an accident. Oh no, yeah, there's possibility of losing life, vision, or limb, or lotino. Now, every other referral outside of this definition, those are called non-emergency referrals, or non-urgent. Now, I do understand at LBJ, when your referral is sent over to us, it comes in categories or different levels. For a lot of categorization, or tato non-emergency referrals, there's level 1, attention tato officer, 2, lolo, and then 3, okay, it's not so urgent, so it prioritized officer level 1s and 2. So level 1s trumps 2, 2 trumps 3, and solo. Yeah, the wing referrals, or there's an emergency referral, and then there's a non-emergency referral. Okay, so that's emergency referrals. Sorry. That's the emergency referrals I was talking about. And now we're moving on to eligibility. Again, and I know each presentation and each presenter, we were targeting eligibility. Safaila vision, Adwatsul eligibility. And I know by now you're like, we know. But again, for off-island Medicaid referral, here are the eligibility requirements. 1, you must be a U.S. national. 2, you must be a U.S. citizen. 3, lawfully present children under 21. Malava, lalo malilus futasi tausanga. Ato ay matangata noon America Samoa, ma America, o I lātou ia anga va'a prokalame nea off-island Medicaid referral. Yeah, again, you have the notes there and what you know in red. Everyone must be bona fide residents of American Samoa. Again, you have to have at least lived in American Samoa for a year. Yeah. And a good example would be, because we do cover children under 21 for any nationality and citizenship, there have been cases in the past where you just traveled here just to jump on the program. And unfortunately, the category is not just children under 21. You have to be a lawfully present children under 21. If apena foi nacionale, my citizens, you have to be lawfully present. You can't just come just to hop on the program. And again, that is the role and responsibility of the Benefits and Eligibility Division, in thoroughly screening the beneficiaries to make sure they are true beneficiaries and true residents of American Samoa. Now, how do we go about identifying or determining true residency? Again, we ask for your passport or your birth certificate and 2 local identification cards. And if we are unable to prove your residency for whatever reason, then we do have a partnership with Department of Legal Affairs and Immigration, as I mentioned earlier, where we would have to do what's called a movement profile to determine when you entered the country or the territory and when you departed. Non-emergency referral eligibility. This is the Ainga Care Initiative. So again, for all our local services, we did mention that CAs and AAs are eligible for all local services. Now, this is an extension of coverage as well. We have included in our Ainga Care Initiative CAs and AAs, only to Hawaii and those who have Medicare. Olewinga from Salanga, if you are a permanent resident of American Samoa, a one parent, you hold immigration IDs of CA and AA, you have been referred, but you also have Medicare as your primary insurance. No, winga. O tangata sana no foi nei whaingaruenga, tongina fonga, watipi sanga le muse to low, and now they're retired. They were tali insure Medicare o ila tola ye anga for off-island Medicaid referral. So Medicare patients with CA and AA o ila tola ye anga malanga to Hawaii. Again, how does that happen? Similar to Medicare patients with U.S. nationality and citizenship, we send your cases to Hawaii to our provider networks. And once it's accepted, your Medicare, your primary insurance picks up the 80%. Yeah, and again, Medicaid being the payer of last resort, it pick up in my total 20%. Okay, there's a question. Mike, please.
So what you're really saying, I have grandchildren who are U.S. citizens. Afapela will move Malako Samoa. They can't get treated unless they're bona fide, because they won't be eligible.
They can be seen at LBJ and DLH, but they won't be eligible for the off-island Medicaid referral, unless we'll reach the Tosama.
Okay, thank you.
Okay, we will reserve all our questions for the end of the presentation, but we will go ahead and continue. So that is the Ainga Care Initiative. Again, it targets its extension of our coverage for CAs and AAs, which are American Samoa permanent residents, as well as our one-parent residents. Hey, Medicaid coverage. Yeah. If you see here, these are some of the benefits, not just going on the program, but once you get approved for the program. For the patient, there is 100% coverage for medical bills. If you come from LBJ to our office and now you're approved to go off island, you've been accepted by accepting a provider in Hawaii or in New Zealand, it's guaranteed that 100% of your medical care coverage is covered by Medicaid. Secondly, 100% coverage for patients' air and ground transportation. Lunawinga le mai, le ngating na tsongi ato lo piri fane mai, cho tsongi ato malo pasese de vaandele, ato ai marita avade fervia ye oi de vao appointments. So that's all covered, air and ground transportation. Thirdly, 100% coverage for accommodation, and this is for the patient. You don't have to worry about where you're staying, and that's the same for Hawaii. Fourthly, we have 100% coverage for minor patient escorts. Now in FY 2025, it's an initiative that escorts must now pay a partial payment. And the reason being is, ina ia serious ayatato escorts. Tēnā tausanga watsua nai, oisi escorts, ia peo laeo e vacation, ia watsia ayatato mai, ia waona o mai e whaita la vai, and then some of them will return without the patient. So it's really an enforcement on our end to make sure that the reason for an escort, medically necessary for the patient, you're going as a caregiver. You're not just going as a travel buddy, but you have to be there all the time, travel with and back with the patient. So now there's 100% coverage for minor patients, escorts. Wingan Famsalanga, for patients that are 17 and under, these are minor patients. So they have to travel with their parents or a guardian or whoever. Now those escorts are fully covered by the Medicaid office. But lastly, there's partial coverage for adult patient escorts. You don't need an escort to travel to wherever you're going. So those escorts, for all adult escorts, started in last October, you have to pay a flat rate escort fee of $500 before you travel to New Zealand. Now for Hawaii, because LBJ still books our Hawaiian fares, there's a discounted fare for the escorts at LBJ. And it usually comes out to about, on a good day, $300, almost $400, and sometimes it's almost the same as the escort fee paid to New Zealand. Medicaid office, off-island medical referral process. Now this is the process, and it was strategically invented. That way no one agency holds all the power in the referral process. So there are a lot of checks and balances in the referral process. But one thing is certain, all referrals come from LBJ. Being our only hospital, LBJ, you would have, if you need assistance off island, you would have to go to the ER or to see your primary physician. And if it can't be done on island, your LBJ referring physician or your doctor will submit a recommendation to the LBJ board. So number one, your LBJ doctor writes the recommendation, and this is the first step of a referral. Now, what tusia na for mai e mana omia o na malanga atu so and so I atu no mamao o na olo o down na tato CT mana omia o na malanga atu o no cataract surgery po alava o le fatu mana omia na bypass. So se twainga mai e mfenfai ine to see law the recommendation. Now when it goes to the LBJ board, they have their meetings, I believe it's weekly, every Wednesday. They have to approve the referral. And once the LBJ board approves every referral, then it comes to our office. Now for eligible patients, it's sen sa o mai lava LBJ na mato ofisa. Given that you are a U.S. national, a citizen, a child under 21, once your referral is approved, LBJ automatically sends it to the Medicaid office. And then what we do is we screen for eligibility. We would call you to provide proof of residency. Now, once we have determined that you are a true resident, you qualify for the Off-Island Medicaid Referral Program, then we send your case, whether it's New Zealand as our primary provider for everyone who does not have insurance but Medicaid, or to Hawaii for our Medicare patients. Once it's sent a FAFO, then we wait. We are waiting for acceptance. Now, the waiting time differs, and it varies amongst different patients. There are times where, one thing is certain, ophthalmology cases in New Zealand, the turnaround time is very fast. Now, some extreme cases, for example, cardio, orthopedic, urology, and neurology, those cases take a little bit more time, but it varies. If fualava ile acceptance rate at New Zealand for Hawaii. Now, mind you, we can process your paperwork today. Say we get your referral today, we can do all the paperwork today, but then wait for at least a month to get acceptance. And that is the reality of referrals. Even if you go off island, you would really have to wait until they are available. Now, reasons for the longer waits. For New Zealand, as an example, they prioritize their citizens. And we are just a secondary priority for them. But because of our relationship over the years with Medicist New Zealand, there is now a very quick turnaround time for our patients. But that is one of the reasons why when we say, that's one of the reasons. Or if you have acceptance, or specialists, but if you are accepted, then we issue what's called a guarantee of payment. This notifies our providers off island that Medicaid will pay for everything for the patient, from your medical bills to where you're staying, your accommodation, air and ground transportation. Acceptance, then we coordinate the logistics. And what I mean by logistics is we call you in. If it's for the New Zealand program, we would call you in. Okay, hi, you need to get your visa photo. Now, even if you are a U.S. national or citizen, when you travel to New Zealand for medical, you require a medical visa. And so over the years, and especially post-COVID, they have increased a lot of their security, their borders and their immigration. Forms. I can count off of the top of my head right now, there's like about 5 forms you need to fill in and complete to get a medical visa. We handle all of that, we call you in, and then we wait, again, for your medical visas to be approved, and then we schedule your departure. So Hawaii or New Zealand, that's all handled by our office, down to when you depart and when you return. Now, when the patient completes the referral and you return home successfully, Medicaid conducts what's called an exit survey. Exit surveys are very important for the program because this helps us learn how the process went. The whole process, from LBJ to Medicaid to Medicist in New Zealand or to Adventist Health in Hawaii, feedback. Your feedback matters to us, and we prioritize this feedback because it helps us improve the program. Now, a good example, they will find on my up to par yan no fuanga lo Hawaii. Ya ole atam 5 au fenga wenga isa ili nisi fane tani malo. Ya ina ya up to par matato sangata no. I may say the well-being fa bef. But one lavani fautuanga or the time there or the exit interview. Yeah, if I do my ya tato fautuanga. Reasons for denial. There's a few reasons for denial. Number one, if you're not eligible, then that's an automatic deny from the office. Two, if your medical diagnosis is not covered under the Medicaid state plan. At this time, not all services are covered under the Medicaid program, especially the off-island Medicaid referral program. For example, cancer. At this time, we do not cover cancer. And so if you are being referred to our office, you tick all the boxes of eligibility. But when it comes to your diagnosis and we cannot cover, then that is another reason why your referral might be denied. Thirdly, as I mentioned, unavailability of medical providers. Again, if there are sometimes, especially during the COVID and post-COVID, there have been a lot of scarcity of resources in our off-island medical providers. And so again, they do prioritize their citizens, but at the same time, they also try to make room for us. Now, if a specialist cannot admit you, or this hospital can't accept you due to the lack of medical beds, that is one of the reasons it delays a FOIA referral, and sometimes it can end up in a denial. Another reason is denied by medical providers. There are some cases when we do send over to New Zealand or Hawaii, they would review the cases and then they would offer their suggestions, and sometimes they would deny the case. For reasons being, everything that's shown in your medical reports, for example, it looks like LBJ is doing everything that they can do and we can't do anything further. So for those reasons, we will have to deny this case. So it's tato cases, and it's the hard truth that we have to relay the message to these patients. But that is one of the reasons why you deny cases. Vava ai mai tato fale mai fafo. Le ai o le sao mameo lo fai LBJ. Therefore ina fai tato telehealth o le sao mamea na fai e pau lava. Wa le toi ai lava sei sif so soani. E mawhai ona offer atu, even if you are being sent off island. And therefore, we would have to decline or deny this case. And lastly, for medevac patients or air ambulance services, tato tangai va'alele ye o mai avatua tato ma'i wha'anatinati, mana o mira fsosoani atunu, or our medevac patients, o tamai va'alele. They are called, they're jet-like aircrafts. They utilize it to providers off island. Now for those aircrafts, there are weight and shoulder width limitations. The smaller aircraft, medevac, it cannot take more than 350 pounds. Yeah, that can be another reason or the denial. O le whātaita inga, e iai ia tātou mai, e le mawhai o na whaofi tonu o le tātou wa'alele se tu low lava. Ia pe awha pe exceed limitation, le limit le au mai for shoulder to shoulder, ia lono winga. O le tātou width le ne. Ia o nisi na, unfortunately, those are some of the reasons why there can be a denial in a referral case. And lastly, I want to speak about escort eligibility, because that is the reason why we are now paying escort fees. Number one, it must be medically necessary. Now, when a referral comes to us from LBJ, the referring physician indicates that this patient, so-and-so, requires a medical escort. Yeah, for patients referrals isau. It indicate or the doctor saying, no, this patient is okay to travel alone. Yeah. But now, secondly, you must have a valid passport. For all travelers traveling on the Medicaid referral program, you must have a passport, especially if you're traveling to New Zealand. It is a must. They do not accept CIs anymore, and that is the reason why we are enforcing a valid passport. Now, because of international travel laws, when you travel, and this is the same when you travel to APIA, if your passport expires in less than 6 months, you will need to renew your passport. Now, that is one of the challenges that we do have, because travel on Tato America, we travel freely. If your passport expires tomorrow and you're leaving tonight, they will still accept you on the plane because you're traveling to the United States with a US passport. But if you're traveling to APIA and to New Zealand, your passport would have to be at least a year valid. Ina ia mwhai ona e answer, ia o reisi nā tūlanga leo whaamarosia nei taimi. An escort must be physically fit, healthy, and able to care for the patient. Telo tanto escorts, they travel as escorts and end up becoming patients. O le fautuanga. So lea whaina o whaamarosia ai, when you come to our office and we're thoroughly screening the patients and escorts, we have to physically look at our escorts. But you have to be able to care for the person that you are traveling with, who is the patient, which is the definition of a medical escort. Yeah, or it's some finance officer. For as escorts and then becoming patients. Because when you do become a patient while you're on travel, it forces our office to cover your medical bills as well. When you could have been, ine, oisi taimi, oatu escorts, the avian medication, so all those reasons, you must be physically fit, healthy, and able to care for the patient. There's also an age eligibility. In the past, 18 and over. Yeah, I think we capped it at 65. Yeah, but this is subject to screening. If one level 40 I, yeah, why ye limas furu malosi, ye for the limas fulu if I malosi late. Must be fluent in English. So this is also a must. Because when you are in New Zealand, although you do have coordinators that will be assisting you, there's nobody better to explain how you feel and how your husband or your patient feels than you. So it is a must that you are able to speak fluent English, at least the basics, the communication. So out of convenience, it's tau lava on the tatsoriloa, lengangana ingilisi. Ya whaingofie the communication, nengate New Zealand, ya I may say for you Hawaii. And lastly, all escorts for patients must pay a fee of $500 before departure. You understand? So flat rate fee na more escorts malava more inato is full of sanga ya mamatuaifo. So all escorts for our older patients, 18 and over, must pay $500, with the exception of escorts. Ya mo atato fana witi. Amatame is full feet to sanga yanga inano. Okay. And I think that is the end of the OMR presentation, but I do want to play the video. So we wanted to include some video testimonials about the program, to try and see how I'm in the program, how was it for you? Please just be honest. If it wasn't good, go ahead and say that. But we weren't able to get as many as we wanted. But we did manage to get one of the most important patients. And the next video message that you're about to watch is the very first Medicaid off-island referral patient. This was the patient that kick-started. If it wasn't for her and the guidance of our previous admins, this program would not have existed. So this is a testimonial from Mrs. Angel Gloria Talifa Fuimono, And she was a stroke patient that we were able to medevac to New Zealand in 2017 in less than 24 hours. She was a nurse at the American Samoa Department of Health, and we were able to save her from her stroke. She returned home. She also served. She went back to work and care for her children, and now she's currently working in El Paso, Texas as a nurse. So,
my name is and I'm now residing here in El Paso, Texas, United States. During the incident, I was living back home in American Samoa. I had an ischemic stroke on November 10, 2017. We were able to receive emergency Medicaid medevac services to New Zealand at this time because the CT scan was down at our only hospital, LBJ's Tropical Medical Center back home. I encourage everyone in American Samoa to seek this opportunity and actually register for the Medicaid program back home because LBJ is our only hospital, and when things are down and not working, there's nowhere else to seek services. But thankfully, we have the Medicare program that can afford us other options, and we can come off island, go to Hawaii, or even New Zealand for other health care services. Like I said, the Medicaid program is very important back home in American Samoa. There's other options for healthcare services that we need. Thank you, Medicaid office.
hey, so that was Mrs. Angel Gloria Talifa Fuimono, the very first patient for the OMR program in 2017. And that concludes the presentation for our Off-Island Medicaid Referral Program. We'd like to open the floor for any questions that you might have, if any. Sure.
Sir?
So an escort, do they have to be a U.S. national or a U.S. citizen to be an escort? Can they be from Samoa, but a permanent resident? Can they also be an escort?
Thank you for the question. At this time, anyone can be an escort so long as you have a passport and you are a resident of American Samoa.
Okay.
And you have to pay $500.
Okay. And last year you guys had a cancer program. You guys, I have a friend that they were in New Zealand, and the doctor wanted them to come back for a follow-up appointment, and we heard the former director a couple months before the election on the radio, John Rayner interview, and right at the end she said we'd have to take care of our cancer patients, and my friend talked with the former director, and she said no problem, you just have to get referred again by your doctor. She got referred again, and then she got rejected. And so she was supposed to go back for a follow-up. The doctor wanted her to, but now she can't do that. And why did you guys, I know cancer treatments is expensive, but you guys did it last year, and cancer is right up there with heart disease as far as mortality. And so I'd just like to see if you guys could address that.
Okay, thank you for the question. So in FY 2023, it is true, we did do a demonstration to cover cancer under the guidance of previous administration and governor. The whole goal of covering cancer in FY 2023 was to try and collect data and to see if this if covering cancer is something that we can do. It's really a funding issue. So in FY 2023, that's why we had a lot of cancer patients that we were sending to New Zealand to try and see and get the data on the costs. Now, what we have concluded at the end of that demonstration phase, we do not have the local match to cover cancer patients. And as a matter of fact, that was one of the main reasons for the hiatus and the suspension of services last year. So, not a service in our state plan, and it's really about funding. We cannot cover cancer for funding reasons. Now, if you do have a follow-up appointment, we do advise that you go through LBJ to get a follow-up referral, and then we can see what we can offer. But at this time, we are not covering cancer. That demonstration phase ended in FY 2024. Is there?
Just to add on Austin's response, that demonstration, we funded that demonstration using our local funding, 100% local funding. So including those eligible U.S. nationals, U.S. citizens that were referred off island for cancer treatments, although they were eligible, but the service was not eligible under the Medicaid state plan. So we had to draw it down from our local funding. So after the demonstration period, we collected the data and we analyzed, and we cannot afford to cover cancer unless we get more local match, additional local match to be able to get this service covered. But we are looking into it. We're looking into it, working together with LBJ and DOH in trying to get the data together. Thank you.
Are there any other questions? Okay, if there are no other questions, I would like to introduce our next presenter. And she is our clinical medical director. Ladies and gentlemen, Dr. Annie Fuavai.
We love Dr. Annie Fuavai.
Good afternoon, everyone. Kafia moya wakamaonga. I'm sure you're going through that stage too. Anyway, it's a real pleasure to be part of this group, the Medicaid Office of American Samoa. And as it stated, my name is Dr. Annie Fuavai, and I'm the Clinical Medical Director for Medicaid. Prior to being part of this group, I'm a retired physician. I'm a physician by profession. And that's after working for 32 years at LBJ Hospital. Thank you. I spent the first 15 years with OBGYN, and then the other 15 years was with emergency room department. Yeah, so I basically know all the services that are available at LBJ after spending 30 plus years at LBJ. So today, I'll be talking about my roles and my responsibilities as the Clinical Medical Director of Medicaid. When we receive a referral from LBJ, basically from LBJ only, if it's a medevac request, that's the one I get onto immediately. And what I do is I review all the notes, the referral notes from the referring physician. O le tāua ia o le o tustusinga le afomai, le refer mainga le case, mai tau le, I don't see the patient. So I depend solely on what they're telling me, what their diagnosis, and why they want to medevac such a case. So after I review that, then I communicate back to them about any further queries or any additional medical information pertaining to the patient. If it's a non-urgent case, I usually review when it's referred by Austin or Langi or whoever in the eligibility department of Medicaid, especially if it's a complex case. Most of these cases are quite complex, very complicated. Peyanto sila fia o le tato atu nuu, o le tele iyo ngase o le tino e mawai. They refer a case for heart surgery or cardiology evaluation, and this particular patient will most likely have diabetes, uncontrolled high blood pressure, have other comorbid conditions that makes the situation very tough, very complicated, and gives me a lot of gray hair trying to figure it out. So like I said, I work closely with the benefits. I also work closely with Tile in terms of making sure that we're doing it legally. And then last one, I am not responsible for approving or denying cases. Fa mole molea o te le approvinga o te le denying for any cases. So if your case is denied, please see Aussie, right? And if your case is approved, thank God it's being approved. But if you have problems with, because I know a lot of the times the people will, when I meet them at groceries, stores and all that, they always say, "Lefa Medicaid, lefa kalia oe." Please go back to your primary care, because that's a very important person. O yesa wai yellow information. So it's either he's not providing me with additional information that I need, and all these information, these are the information e forward lo New Zealand, and it really speeds up the process for New Zealand to accept or deny cases. Okay, so I basically covered my duties, and like I said, I don't deal with patients directly. I deal directly with the referring physicians. I look at the notes, I review the notes, I look at the labs, I look at the x-rays, results, ask for more information, and after we feel that we've completed everything, then we forward it to New Zealand for acceptance or disapproval, or that they don't have the facilities or they don't offer that treatment. So I report directly to the Medicaid director. So I think that's important, because I don't report to anybody else, right? So whatever the director tells me what to do, well, sometimes, but when it comes to approval of cases, we collaborate. Maybe that's a better way of doing it. We discuss and come up with the best solutions for our patients. This is basically for the providers. Unfortunately, they're not here, but these are the ones that I deal directly with. We have standard guidelines for them how to write referral notes. Some of them are not doing it, and again, it will cause a delay in the referring of the patients. And that's why I said it's very important that you go back to your primary care doctor and find out why there's a delay of your referral. So this particular slide is actually for them about the writing of notes and all that. What we're doing is really protecting the integrity of this program, protecting the reputation of our only tertiary medical institution, and that is LBJ, and also to protect the reputation and integrity of our medical staff. And lastly, just use a bit of common sense when they write referral notes to the Medicaid office. Yep, protect the integrity of the program to safeguard resources from fraud, corruption, waste, and abuse. That's like President Trump's favorite now, right? Do you guys like him? Thank you, because I do. Protect the reputation of LBJ Hospital. And lastly, to protect the reputation of our medical staff, mainly the healthcare providers. I think this was covered by Ozzy about our medevac. Our people, they like to be treated like royals. You know, it's just our upbringing. So our medevac, they were treating it like it's a bus or a train. You know, whenever somebody is sick, they want the plane to come over. But it's very costly. So when they request for a medevac, it has to be an emergency case. Not, when I say emergency, like admitted to the hospital, in ICU, unable to walk, unable to talk, and not being out at their house and expect the plane to come and pick them up. So that's what the emergency referrals mean. And that's it. Thank you.
Dr. Annie. Ya, malu alam sa ila tui titi ya uma. Vaftai Dr. Annie, molang fulasanga ili nei afiafi o ili nei tulale aso. Ya ai tu atula vanoa ili tato presenters list so maya ya. Bimana ya ai fai se in sinta mai exercise director se itau fa te ia le malu lule kau sau
How you doing out there, everyone? You okay? Okay, we're gonna wake up a little bit. So I need you, if you can't stand, sit, but if you can stand, stand up. Okay? I'm just gonna put this down.
la so'omaiai. I'd like to introduce our next presenter. This is the Pacific Center in Human Security, housed here at ASCC under the leadership of State Director Tafai Mamao Tua Tupuola. And they will be presenting on the home community-based services and money follows the person. Director?
Good morning. So we should call this session a happy hour session because it's like going towards the end of the day. So I hope I don't put you to sleep. So on your table, there is a handout, a yellow handout. So this is going to be an engaging activity, and I want to hear from you. Am I supposed to? Okay. So navigating home community-based system. I'm going to talk about the service, home community-based services, and then I'm going to share towards the end navigating the system. Next slide. So please take time out right now, engage yourself in the survey that's on there, and I will show the updates as we go. Next slide. So the overview of this presentation is to talk about what is home community-based system, why is it important, and where do we begin? Next slide. So it's really a person-centered approach, how you do service in the community, within a person's home, and that the service that is delivered is done in a location based on that individual's choice. One thing I need to share is that HCBS does not exist in any of the territories. I did not know that until a couple years ago, but it's a very complex system that doesn't exist, so we're still navigating this. Next slide. So HCBS targets 5 population: 65 years and over, physical disability, intellectual and developmental disability like Down syndrome, autism, developmental delay, mental health and substance use disorder, and then there's other. Other we would like to think of like HIV, and then when they reach a certain level of care with cancer and it's long-term moving forward, they can be covered in this other population. One thing I want to also emphasize about HCBS, it is still anchored to a Medicaid eligibility and qualification. So it doesn't have its own eligibility. It still will anchor to the state Medicaid state plan eligibility criteria. Next slide. So these are just some of the examples, and you'll see that on the QR code that's on your table. It could be personal care service. We hear this all the time. We heard it this morning about caregivers being paid at home. It also covers home health aid, homemaker. In the case where people are at home and they're home by themselves, and they just need somebody to help them clean up their house probably 2 days out of the week, help them do laundry, help them do small errands, that would be something of a homemaker. Adult day health, if no one is able to be with them at home because everyone's working, adult day health can cover that. There's also medical daycare, education such as special ed and related services, because there are some cases where physical therapy, occupational therapy, and speech is needed, and this can be covered within the school system. In addition to habilitation, case management, and then supported employment. I won't go into the fine print detail, but give you a general idea. Next slide. And then there's more services. The thing is with HCBS services, it's not just a service. There's a lot of hidden nuances that needs to be built to kind of get your foot in the door with approved services. Also, it covers like clinic. I think that was a conversation this morning. Pre-vocational skills, mental health services. Next. So again, this was actually one where we were pushing out the poll. What HCBS service is important to you? So if you have time, please go ahead and take a quick poll and respond to see what is important to you. We just wanted to hear from you, and then it'll show up towards the end of the presentation. Next. So this is why, sorry, I have ADHD, so I don't stand still. So this was in our comprehensive system assessment that we pushed out about 2 years ago. And a lot of the disabilities reported here falls under intellectual and developmental disability. When they exit a school system, they're left at home. There's no continuing care for them at home unless it's through the emergency room. But they have an opportunity to continue receiving some type of health care service. So if you were to look at Down syndrome, autism, this is also being, on a rise with autism. There are families that have 2 children with autism, 2 or 3 child or adult children with autism. Next. So now we talk about the aging caregivers. This was also mentioned in the speech this morning. 2020 census, 3,174, 65 years and over. 145 of this are 85 years and over. If you look on the far right, that is the data of grandparents living with children who are the caregivers. Even with the age providing the basic need, 5 years and over. And then the bottom basically tells you the dynamics of grandparents living in a multi-generational home. So as you can see, older people are living longer. They are also aging caregivers. But then at the end of the day, who's taking care of our grandparents or our parents? Next. So why is this important? Because 54% is at the poverty line for American Samoa. That is our median household, 28,539. Family members quit their jobs. It's usually the breadwinner that still attains their employment to keep the family functional. But guess what happens to the caregiver? As they age, aging with the person they're taking care of, that when that person is gone and they're ready to file for, the caregiver is ready to file for Social Security, they don't qualify because they don't have enough credits. So they're working in a non-payment system not contributing to the Social Security credits. Then the cycle repeats itself, right? Then who's gonna take care of that caregiver? Somebody quits their job, and the cycle starts over and over again. Then you look, here was a survey we did, and as you can see, 92% are unpaid caregivers. So the individual does not receive quality of care simply because you're just meeting the minimum. And then many times they don't always do training for caregivers or even ask for feedback from the person themselves. So as I mentioned earlier, caregivers age and then they do not qualify for Social Security. Next. So where do we begin? We just have to navigate the unknown. All these years we figured, oh, because the territory doesn't qualify. Then we kept hearing more and more people saying they don't qualify for Social Security because they quit their job to take care of mom and dad, and then it keeps going and it keeps going. It becomes this cycle of economic insecurity in our community. Next. So we have the Medicaid state plan, and like I said, that basically anchors who qualifies for the service, the eligibility criteria. The HCBS waiver basically protects the service that is designed for the target population, that is designed for how many times they get the services a week, how many days in a week do they get adult day health. Everything is designed in this waiver. Then it works side by side as an annex document. If approved, it works side by side with the Medicaid state plan. But as the Medicaid state plan goes through its years of amendment, this waiver still protects the intention it's intended for the population it serves. Okay, next. So, what does a roadmap look like? I tell you, it was a complicated thing to start with. We started reading all sorts of regulations. We thought, okay, this is simple, just identify the target group, and then we'll see what health policy needed to be made. But even some of our policies were outdated, and trying to meet in the middle with CMS's regulation was also challenging. So then what happened a lot was we couldn't find the data to justify it. So we were also struggling with missing health data. We were also trying to navigate the payment rate. How much would a caregiver get paid for? And then realize, oh, wait a minute, we need another agency to pay the caregiver. Oh, wait a minute, can that agency do Social Security deduction to make sure the caregivers are paying into a system? So there were a lot of nuances on top of other complications that we had navigated in the past 2 years. Then it also came to the point of, is it time to talk about the local match? Should we talk about the local match, or should we wait till we're almost there and then talk about the local match? Then at the end of the day, because this does not exist in any of the territories, and we're sort of leading the conversation, we don't even have regulations in place to regulate adult day health, caregivers in the community. So it's basically also building the unknown. But we need to still start somewhere.
At the end of the day, the people are waiting for the service. So we're still trying to navigate this. Our goal is to complete everything. I don't want to jinx it, but hopefully in the summer. However, we're still trying to navigate the issues that with Washington, D.C. as well. Next. So here, we just got approved to invest in a health data dashboard. This is not real data. This is just an example of the dashboard that was presented to us. The health data dashboard is intended to share it with the community, to kind of give the community some latest update of the number of people being served, what is their type of condition, what group do they fall under, how many were transitioning into the community to get this service. It's basically made for the community to access. I know in the past, people tend to get very territorial of the data, but we need to start somewhere in sharing the data. A lot of the hiccups that we've experienced in putting this together is because nobody wanted to share their data. So we had to start from zero in trying to collect data. So now we just make data available on our website. If you want to know what the report is, go to our website. But when we got the approval for the health data dashboard, we figured an opportunity to get everybody to go to the data dashboard and see what's the latest update. Next. And apparently nobody ended up answering the question, but it was a way to kind of like get a general idea of what do you think is important out there. Next. Oh, and it's not updated? Oh. Oh. So I guess it went inactive after when I changed the slide. It was, oh, there you go. Pay the family members. You can do it now. I'll spend 2 minutes. So the reason why family members, we wanted to recognize family as paid caregivers also is because in many cases, the individual will not be receptive to a stranger coming in the house, and having the family member be recognized as that official caregiver will be more receptive in the home. Oh, there you go. So who's winning? 88 participants, 88%. Nice. So there you have it. We need to pay our family members as caregivers. Definitely adult day helped as well. Next. Am I done? Oh, and I'm done. I'll go ahead and turn the time over to Lori, and then we can be open for questions afterwards. Thank you.
Good afternoon, everyone. I'm just waiting for them to put the presentation on, but I want to reiterate something that a teacher taught me in high school. That was to kiss whatever presentation that you're doing, and so to keep it simple, sweetheart. So once they get the presentation on, there will be a few slides, and then we'll go into question and answer. Next slide, please. What is Money Follows the Person? So Money Follows the Person is a federal initiative through the Medicaid program, It helps individuals to transfer and transition out of long-term stays at an institution, which right now is only LBJ here in American Samoa. So transitioning from those institutions into their communities and respective homes. As I mentioned, LBJ is the only qualified institution locally, and by transitioning through Money Follows the Person, we're able to lighten the load from LBJ and welcome our participants back into their homes and respective communities. This also helps to promote independence of the participant, to choose where they're going to be receiving their services of care, as well as the medical needs that they require. Next slide, please. So what are the goals of MFP? The goals of MFP, again, are to increase the use of HCBS, which is what Tafa just talked about, transitioning our participants back into, out of institutions and back into their communities, expanding access to affordable, high-quality community services, reducing reliance on institutional care, which then lessens the load for LBJ, and then provide necessary supports to help participants live independently and improve their quality of life. Next slide. So who is eligible? Individuals living in a qualified institution. The minimum requirement for MFP right now is 60 days. American Samoa's MFP program hopes to invoke a waiver to bring that number down to 30. So a person would have to be institutionalized for 30 consecutive days to participate in the MFP program. They must be eligible for Medicaid. I think Medicaid did an amazing job today educating us on what qualifies you and makes you eligible to be a Medicaid recipient. You must be 65 years or older and or a person with a physical disability. Next slide, please. Thank you. So these are the steps for enrollment. The first step, once you are considered eligible for the program, the referral process starts. So the referral process can be done by, a physician from the hospital, a facility staff member, it could be an RN, it could be a therapist, a case manager. The participant can self-refer themselves. A family member and or a caregiver can also start the referral process with Money Follows the Person. Once they go into the referral process, step 2 is then approval. MFP will collect this information and go through the necessary steps to confirm whether they are approved or not, and then the planning starts. So a person will have a plan of care. That's basically their medical needs from the facility that they are transitioning from, and then they will also have a person-centered plan made available for them. So last 2 weeks ago, we had a great certification on person-centered thinking through Money Follows the Person. So those would be the first steps in getting a person-centered plan in place. I will touch base on that in the next slide. Once all that planning happens and everything is in place, then the transition begins. So the person-centered plan. This plan is a living plan. It's not one that just gets made and then that's it. So this plan is living and growing. It follows the person from institution to home to whoever it is that is providing service. They will all get a chance to review this plan. We've learned through this certification that we went through, it's important that we're all on the same page when we're providing services to our participants. So if we know that Jane Doe doesn't like oranges, we're not going to go out of our way to find oranges for Jane Doe, right? The purpose of this plan is to provide a way for us to make sure that our participants are reaching their goals, their personal goals. This plan is not just about hearing what a person wants or needs, it's actively listening. We're teaching ourselves to actively listen so that the person's, not only what is important to them, but what is also important for them as well. So all of this is put into this plan, and this plan then follows that person throughout the duration of their transition. Next slide, please. So what services may be provided by MFP? A transition coordinator will work directly with the participant. The participant is very much engaged in this transition plan, and anybody of their choosing is also going to be included in the conversation, whether that's a caregiver, whether that's a family member, an additional physician, everybody that the participant feels that is needed to go from step A to the end of the transition plan, they will all be included in participating and creating this plan. Home modification and assistive technology, so that could be a ramp that is needed at the house or grab bars in the shower areas or around the house as well. Okay, if the person decides they want to rent, they don't want to return back to their original house, the MFP staff will help to find affordable housing. Also, as Tafa touched base on the different types of community-based services, whether that's home care, it could be different types of therapies that the person may need, that would be included in their plan of care from the facility that they're transitioning from. Transportation may be included, that's emergency and non-emergency transportation. DMEs, as was discussed extensively by the Medicaid office, can also be covered by MFP. And then the case management and support. Next slide, please. Okay, benefits of participating in MFP. Quality of life improves. This is not just the quality of life of the participant. If everybody understands what the participant's needs are, the quality of life at home is going to be increased as well. Caregivers understand what the participant needs, family members understand what the participant needs, and everybody's on the same page. Families become more involved in care, they understand the individual's needs and wants, and are able to provide that care based off of the person's person-centered plan. MFP helps to provide safer, personalized care in the privacy of their own homes. This also, again, alleviates the stress on LBJ to hold such a high load for our island community. Next slide, please. Okay, and just to recap, again, this is a Medicaid initiative. Our target population are those who are 65 or older and persons with physical disabilities who are eligible for Medicaid. Each person will have a plan of care from their facility and a person-centered plan that will follow them. Again, MFP promotes independence and improves the quality of life of not only the participants, but also their families. And then next question, please. Yep. Now we're at the question and answer section. If there are any questions. I did forget to mention, I apologize for this. We are in the planning phases of money follows the person. So this is, we're very much in the building blocks of it. Just as Safad said, the roadmap is still in place, but we are happy to answer any questions if there are any. No? Okay. Safad, anything else from your end? Okay, thank you so much for the opportunity. Have a great day.
Tailava, Director Tafa, and especially Lori, for your time. When we do have questions, we'll direct them your way. So okay to follow? All right, thank you. Ia wala malama whai I fo I le whaamoemoe I le aso. Ia le taimi nei. I tu atu pēr lava noa. I iei lava se mea e fia fasili ai se tasi. Fia whaamalama atu fo I le ofisa. Ia e le I tapu ia loa ia le tato aso mua o le Medicaid Summit. Austin, Sumailuma, Tinaya, Trudy.
Time will have Noah. Ele os efesibi. Ale ripotile na umatunea tafaman glory. Matautia etaua ya tato. On me amoni lava. The old people are feeling left out. When they're retired, they stay home. And their children are so busy that they tell other people, oh, my parents don't drive anymore. So it's very valuable that they're reaching out to work with you people. Because that, to me, is really the crux of what today is all about. Tufatasi. You and the community, let alone a group like Safa's group from ASCC. And I want to say that I'm very honored that I was here to hear all of you people, the good, the bad, and the super good, you know, from today, and I thank you.
Whaftai lava, Tinaya Trudy. Ia, e whole whamoe le anga lue whatasi mātou ma le Pacific Center of Human Security. Ia, wā whele lumanai o le neipolo kalama mo na ngā. Ia, tonu o le eini fasili. I wale e fo I se isi lava mea e ala taimi nei ma lo lava le onsai. Ia leo wa tātou tau nuu mai le si ui o le wha moe o le aso mua le nei wha atasinga. Wha ma lo lava le wha pale I momole atu le nganga wha aftai le wha awanoa ino o tau taimi. E awai mai ai le nei maftanga. Ia manatua le anawa tau o le nei wha moe. O le tā ngaluenga tau soa whaatasi. E tā ua lau leo. E tā ua o manatu. E tā ua le tātou ngā lulue whaatasi. As we conclude day one of the Medicaid Summit, we want to express our sincere gratitude to each of you for your participation, engagement, and valuable contributions throughout today's discussions. Your presence here reflects a shared commitment to strengthening healthcare services and ensuring that Medicaid continues to serve the people of American Samoa effectively. Today, I'd like to share some exciting news with you. Just this afternoon, we talked about how orthodontics dental services for our children were submitted in the ending of December. We just received word today in the afternoon that it has been approved. So this was a team effort. We also thank our private provider, Island Smiles, for Dr. Toko's patience as we've been working on this for like more than 2 years. And we thank you. You know, so right now what we're gonna be doing is we're gonna finalize and develop our internal policies and procedures. And because CMS will also require us to see that. And when the time comes for Dr. Toko to open his doors to the public, we will definitely let you know. So the last 2 spas that we've approved was Hope Dialysis and now our orthodontics dental services. So we would also like to thank Pacific Center Human Security, the State Director and her team with their contribution to our summit this year. They offered to pay the venue for the next 3 days. Thank you so much, Director. We truly appreciate your contribution. Once again, thank you for your dedication, your insights, and your commitment to the well-being of our people. Tomorrow will be the second day, and it will be for our providers. It's open to the public, but the topic tomorrow will be for providers. So if there's nothing else, I would like to ask Austin, for a prayer to close off today.
As our summit ordained minister, I would like to say prayer to conclude our summit day 1. Tato ifo matsalo. Wa mai anga duenga tangata I lene yaso sa fia ngai foi nene ofisa ya e maise o mamado de atunu o mato paanga o faarudunga o fainga malo o matanga duenga taitasi o pisi nisi ya e maise foi o company ne ngata idea o auna sa mfaya na mafuta fia mori mawina le nei fa moe wei umane manuia ne aso mua mato vi ia pea oero mato tama ai mato te tano ne ato lava de sangata e lava fa ne tonu la fa ia tu pe la fio ne ia wi manga no mato uma i le toto ta volo lavalo Yesu Keriso a le nei tu la ne ata ape filia di matu wa ma fua mato fa tangisia la pui nga manu ia I mato malavo I tono nei manu ia mai ser fenga solo ia lo atunu ine ia tai fine mur so fua ma le ono lo fa na I ngoro fa tani mai ia ai fo ia pervi inga ia te ora mato tama mato tano tu ina te per fa mo ne ia so duo to toyo le nei fa mo ina ia lo fa ngia fa I mai mana tsunga le lei ia ai are fa wina na mato va ina ia mawhai ana mātou ngā lulu e pia, o so tau au, ia mo se Amerika Samoa soifua mālolo hina. O nāna mātou tāno, whaina mātou whaatasi matalo le leo loto mana ngā o te sangata lava ia. Whai e pia lo lava whina ngano, e awa lava o mātou loto whaatau va. So fa o Yesu Keriso o mātou wone mana awa toa. And everybody say, Amen. Manuia le nei auli, whaafitai, tātou whailoa I ne aso mua.
Ia o loo maua pea le mea tau sami, pea wha pea mana o mia se take out. Ia o loo